are a united community.
We may not be blood related,
but we Patriots are one big family.
Being part of the PWU community strengthens us.
Through the years, we support each other through good times and bad times.
We Patriots always have each other's back.
It's a big honor to be part of a community that is open to the ideas of each other.
It drives us to excel and be the best version of ourselves.
That's the standard of excellence that we Patriots strive for.
I'm thankful that this community lets us be who we want to be.
We thrive because we accept each other for who we are.
And like a family, we treat each other equally.
Actually, PWU gave us a home and helped us to be a patriot in society.
We may have different individual drums and instruments,
but we march with the same beat together as one united community.
Do you want to march with our community of patriots?
I am a patriot.
I am a patriot.
I am a patriot.
I am a patriot.
Good day, participants! This is going to be a fun-filled webinar. Just remember to follow these few online etiquettes for our webinar. Number 1. In line with the Data Privacy Act, we would like to inform you that this webinar is recorded. Your participation means you are giving consent to be recorded. Number 2. Be on time. Be here 10 minutes before the webinar starts. Number 3. Be prepared. Find a quiet place free from distractions. Be sure that your gadget is charged. Use headphones if you have them. Number 4. Keep your microphone on mute. If you would like to speak, click the hand raise icon or say permission to speak, then wait for the facilitator to address your concern. Number 5. Be responsible in the chat box. Use the chat box for webinar-related matters only. Number 6. Take down notes. Writing down notes will help you remember important concepts from the webinar. Number 7. Be fully present. Pay attention to what the speaker is sharing and participate actively. Lastly, number 8, do not forget to accomplish the attendance and evaluation right after the webinar.
Electric fan.
Good morning, everyone. Welcome and thank you for finding time to be with us today. I am Therese Antoinette D. Juliales, Doctor of Philosophy and Nursing student at the Philippine Women's University, and I will be your moderator for this webinar. Before we start, I would like to know how my fellow nurses are doing. I know you are all enthusiastic to participate in this webinar. Please type in the chat box and please click the heart reaction so I know you guys are there. I am very excited because in the next few hours, I am affirmative that our participants will learn tremendously from our well-esteemed guest speakers. Okay, I can see flying hearts here in my chat box. I would like to acknowledge our participants from all over the world, from Saudi Arabia, Qatar, UAE, USA, China, Indonesia, and of course, our beloved country, the Philippines. Before we proceed, I would like to inform everyone that we are live via Facebook, YouTube, and Zoom. Please click share so that more of our nursing community may be with us this morning. And to prepare ourselves for today's activity, let us begin with the invocation to be followed by the singing of the Philippine National Anthem.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين.
Mga kababayan, ang pambansang awit ng Pilipinas.
Kayang magiliw, helas na sikatanan, alam ng puso, sa titik ko'y kubay. Lupang bihirang, kuya ka ng magiting, sa manluluping, di ka pasisigil, sa nagagang tutok sa simoy at sa langit kong pagaw, ay hiragang tula, kawin sa pagkayang minamahal. Ang isang ng atawan ko'y tagumpay na nagtitigil, bakit tuwing at araw niya kailan pa may magtitigil. Lumanang araw ng warhabit pagsingka, ko'y langit sa piling mo. Ang hinigaya ng pagkay mga akin, at mamatay ng dahil sa'yo.
Good morning once again. We are so happy with your presence and participation in this activity. Since we have started the program, we already have hundreds of people on Facebook Live, YouTube, and on Zoom. These figures are already across our 3 platforms, so please do not forget to click, like, comment, share your reactions, and share this event so that more people will be within our reach. We, the Doctor of Philosophy in Nursing students, currently enrolled in the subject Governance in Healthcare Practice, are proud to present you this webinar with the theme, Good Governance, Paradigm Shift in Nursing Practices. For our objectives, at the end of this webinar, the participants will be able to, first, determine the importance and impact of good governance in nursing. Second, describe good governance approaches that will promote effective service delivery practices in public health, nursing practice, and nursing education. And third, integrate good governance in nursing to assess and monitor progress in public health, nursing practice, and nursing education. Now, here are some reminders for this webinar. You can expect each speaker to have the platform for about 30 minutes, and we will conduct the question and answer portion at the end of each session. If you have any questions for the speaker, please type them in the live streaming chat box and we will address them during the question and answer portion. I would also like to remind everyone that you will be able to obtain the certificate of attendance after filling up the evaluation form. The evaluation form link will be posted at the end of this webinar. And now, let us formally open our program. May I call on our class president, Mr. Franz Farne, to give his welcome remarks.
Good day. Thank you to each and every one of you for being here virtually with us today. I am Franz Farne, and I am the president of the class in Nursing Governance in the Postgraduate Studies, Doctor of Philosophy in Nursing, here in the Philippine Women's University. And on behalf of my co-students, we are very pleased to be able to welcome those of you that have been with us today. Today marks our much-awaited webinar entitled Good Governance, a Paradigm Shift in Our Nursing Practice. And we are proud to be able to host it through this online platform with all of you. Before we get started, on behalf of our class, I would like to express my sincere appreciation to the people who generously help us make this online event come together to become a success. To our Professor Dr. Mark Santos and to our Dean, Dr. Minerva Diana, thank you very much. We couldn't have done it without you. In today's gathering, I would like to focus on all our participants who registered and attending with us today. To our fellow colleagues from the different field of nursing, to the teachers, students, and other allied health. Your passion to learn even in these challenging times gave us the motivation and the energy to make this wonderful event possible. There will be no webinar like this without you all. In the next few hours, you will be learning the new trend of governance in our profession. For 40 years, it is a battle cry for us nurses to have a voice and to be part of an organization who provide a positive workplace environment to respect and share decision making. We will be learning all about this topic from the finest experts from our country and abroad. And I hope that it will help us to grow in our profession and be the voice of this professional nursing governance in our own respective institutions. Well, I don't want to take too much of your time. The day will be fun and full of learning. So a very warm welcome to each and every one of you. Thank you.
Thank you very much, Mr. Farne, for the wonderful opening remarks and warm welcome. And now we move forward to our first resource speaker. I would like to call on Ms. Maria Socorro Castillo, PhD in nursing student, to introduce us to a remarkable and well-known figure in the international nursing community.
Good morning, everyone. It is a great honor to introduce one of our resource speakers for this morning, a dear friend of mine. Dr. Marie Antoinette Ortalis' humble beginnings began when she earned her Bachelor's of Science in Nursing from Colegio San Agustin Bacolod in Negros Occidental. After she graduated, she emerged as one of the top-notchers of the nurse licensure in the Philippines. She finished her master's degree in healthcare administration in 2010 and completed the Doctor of Education degree in higher education administration in 2014 from the New England College, New Hampshire, USA. She also finished the Global Health Delivery course of the prestigious Harvard University in 2018. Her professional experience includes various roles encompassing clinical manager in critical units, critical care clinician, cardiothoracic clinician, nurse educator, preceptor, administrator, and nurse entrepreneur. She's the founder of an organization of her namesake that focuses on continuing education for nurses as her most remarkable achievement in the nursing profession. She is the executive and managing director of Westchester County Filipino American Nurses Association of New York and the immediate past president of the Philippine Nurse Association, New York, in 2018 to 2020. She's a multi-awarded recipient as a Rookie of the Year of the Philippine Nurse Association of America in 2020, Advocacy and Innovative Service as a chapter president, PNAA and Eastern Region 2020. Atlas Award for Advocacy Efforts, Eastern Region 2019, and an Outstanding Leader Advocate for Education and Professional Development Award, Eastern Region 2019. National Excellence in Education Award, PNAA in 2014. Keynote speaker for the International Conference, The Future of Nursing 2021 to 2022. Ladies and gentlemen, let us all welcome the multi-awarded nurse leader and a dynamic speaker, Dr. Marie Antoinette Ortalis.
Good morning, Philippine Women's University PhD class, including viewers from the university and other viewers. My name is Dr. Marie Ortalis. Thank you for having me. I'm the president of Marie Ortalis Center, Inc. in New York City, and also the founder. I've been a nurse in the United States for 38 years, and I'm very happy that you invited me to speak about this subject today. So I'm recording this and hoping that everything will go well, right? And you know how technology goes sometimes. So as far as the topic for today, I would like to begin with, well, we do have a PowerPoint. Let me share my PowerPoint, and I think I'm sharing right now. So our title is Good Governance in Nursing, and we will try to cover how it applies to administration, education, research, and clinical practice. So to begin with, we have our learning objectives, and the learning outcomes says upon completion of the lecture, the learners will be able to articulate the significance of good governance applicable to nursing, education, practice, administration, and research. Another outcome, implement the process and structure of good governance, now called professional governance, in various dimensions of nursing practice. So here is a very general definition of governance, which was described in the Merriam-Webster dictionary. It says the act or process of governing or overseeing the control and direction of something, such as a country or an organization. So let's put that in a nursing context. In nursing, good governance is establishing effective health systems, empowerment, engagement, autonomy, critical thinking based on best practices. That is my definition for you today. So we will talk about the beginnings of nursing governance. Let me just magnify my screen a little bit. So governance dates back from the time of exemplary nurse leaders. Nurse leaders established best practices using their passion for nursing. They had a purpose in the nursing profession and were all from different backgrounds and different situations in life. Were able to break barriers, leading to changes in nursing and in society. They used their passion, skills, and leadership abilities to coordinate care, supervise care, and lead by example. And they brought about good outcomes in healthcare, specifically nursing. So that is the end result, good outcomes in healthcare. And nowadays we call it quality and safety in patient care. So I have a few very, very good examples of nursing leaders, as there are so many of them worldwide. So we have exemplary nurse leaders examples for you this morning. We have Florence Nightingale, who taught us infection control. And so she was our first teacher for hospital hygiene and sanitation. She was also a statistician, and she had a compassion for caring. And that's why we call her the mother of nursing. And you know her as the lady with the lamp. So Florence actually was so compassionate about taking care of sanitation and infection control when she visited the soldiers in the Crimean War, where she was asked to come in that facility and help. And there were so many deaths coming from sepsis. And she found out that the conditions were so filthy. And so she required infection control practices right away. Then we have Virginia Henderson, who came after Florence. She's an author, theorist, researcher. She discussed the need theory, and she's also called the Nightingale of modern nursing. She defined nursing practice, how it should be, which tells us that as long as we teach our patients what should be done after they're discharged from the hospital, let's teach them to be independent and take care of themselves and not just be patients all the way. So she taught us that independence of patients. So then we have okay, so that's Florence. Okay, so we go to the next exemplary leaders. We have Hazel Brown, who was denied entry into the nursing school because of her race and succeeded in attending a nursing school in New York. She enlisted in the Army, where she earned multiple promotions and later became the director of Walter Reed Army Institute of Nursing. That's Miss Brown. Then we have Mary Breckenridge, who became the most famous nurse in Appalachian history. She took up nursing in 1918 during the flu epidemic and later founded the Frontier Nursing Service and later the Frontier School of Midwifery and Nursing in Appalachia, which still functions up to this day. Okay, so we have two more here as an example. We have Goldie Brangman, a nurse anesthetist who was the co-founder of the School of Anesthesia at Harlem Hospital in 1951. Sojourn Truth, an informally trained nurse, advocated for formal nurse training and education and demanded equality for women. African Americans made her one of the most famous nurses in history. So these women were involved in governance, but really from their own abilities and talents. They did not have a system. They did not have a team that we have now, which we call the healthcare team. They did it out of their compassion, caring, abilities, talents, and determination to be what they had to be as far as giving care and making a difference in the nursing profession. I'm sure you've seen this next picture many, many times. These are the nurses in the Philippines years ago who actually were the original caregivers in the nursing in the Philippine Red Cross in the Philippines. So many more nurses are remembered by the nursing profession in shaping policy, creating change, transforming the goals of nursing care in the process of improving the profession and the provision of quality and safety in care. Their work was enlightening to the world. So they enlightened nurses worldwide. Then I came up, as I was making this PowerPoint for you, I came up with my own interpretation of what governance is all about. So what is nursing governance? To me, it's the power to lead in any aspect of nursing where you use your strength. Where is your strength, right? Use that. As nursing is multifaceted, it's not really a paradigm shift, but a refocusing of one's strength in a chosen field in nursing, be it in education, clinical practice, community service, research, administration, and policy. So refocusing requires factors that contribute to strength, such as knowledge, experience, which led us to our own expertise, constant involvement in research to find out what has been proven that can lead to best practices, awareness of the environment, current trends and issues that need to be dealt with, and most importantly, forming strong alliances with nurse leaders and colleagues, nursing organizations, community services, and governmental services. What a huge definition I came up with. But as I wrote this, I was thinking of myself. What was the trajectory of my own practice? How did I govern my own practice? So I did that with knowledge and experience. As you know, trajectory means you're evolving from the novice nurse to the advanced practitioner. And how did I evolve and how did I govern? Well, I used my own powers as far as my knowledge and expertise. But most importantly, I realized that governing also means collaborating with nurse leaders, collaborating with organizations, community service, and most of all, governmental services. So we can also participate in shaping policy. And that's what came to my mind when I brought up these definitions for you guys to share. So here I have a picture of global nurse leaders. I attended the ICN, which is the International Council of Nurses, because one of the research that was approved, but was my research. There were 300 research studies which were presented in the ICN, and out of the 300, I think they had like 50 which they picked, and my research was one of them. So I have my colleagues here. Of course, when you attend international conferences, you're bound to meet people from all over the world. At this point during this conference, there were supposedly 12,500 nurses worldwide who enlisted. And I think only 8,000 attended because there was the fear of SARS. And SARS was scary. And it was the center of SARS at that time was Korea. But that did not stop me, Seoul, Korea. That did not stop me from going, because I said, this is an opportunity because I'm going to meet a lot of nurses and I'm going to attend all those lectures that will be presented by these nurses. So then I have presented my research, sharing my dissertation to nurses globally will impact best practices in nursing. Through nursing research, we have a voice, a strong path towards autonomy and professional governance. So thousands and thousands of nurses research every year, those who are going for their master's and their doctorate. And you know what becomes of it? Research becomes best practices. So mine was more on preceptor training. What is the impact of preceptor training? That was what I researched on, because I believe that preceptors need to be trained in order to deliver knowledge and skills to orientees, and which is so important delivering knowledge and skills to orientees, there's that sacred moment where you are very impactful in the learning of the orientees. So that was my research. So here is different levels of what governance is about nowadays, from comparing it with the time of those exemplary nurse leaders who did govern using their own compassion and caring and their expertise, knowledge, and abilities. Today, boundaries defining governance can range from direct patient care decisions to decisions for managing the work environment. So we would like nurses to be empowered in order for them to be autonomous and use their critical thinking and decision-making skills. That is what it's all about now. So theories of governance springs from organizational governance, where it involves the leader and the worker. The leader has to show the best performance in the system of healthcare, because the nurse leaders, like administrators, they're in charge of making sure that the entire system is running well. So we have emphasis on cost effectiveness and quality in patient care. So they have to cover that too. How effective is nursing care? How much money is the hospital shelling out for a particular diagnosis and care? So we really want the proper nursing care, the best nursing care to be provided so that patient outcomes are great. At the same time, cost effectiveness is good. So the worker has to show the best performance of task in nursing, but that worker needs to also be supported by administration. That's what governance is all about. So some theories that I want to share with you. Well, you heard about shared governance. Shared governance came out in 1988. And what is it now, 2022? So it's been more than 30 years that there has been difficulties, challenges, and barriers to shared governance, but that's where it all came from. So governance can range from direct patient care decisions to decisions in managing work environment. And that is from these authors here, Burnhope and Edmund Stone. And also shared governance targets decision-making across types of decisions. And this is moving from the hierarchical structure to the counselor structure. So hierarchy means top down, from the top, from the leaders down to the members. And now it's not like that. It's more of like your committees. What are your committees talking about? What is the goal? What do you want to achieve? And that is the counselor structure. So evidence suggests that improved financial picture after implementing shared governance will lead to cost savings and cost reductions. Committee structure resulted in overall hours spent in meetings, but the meeting hours per full-time equivalent dropped. So there was a committee structure where leaders and members had to meet and discuss, and that's when they felt empowered, and that is governance. So let me go to my next slide and just make sure everything works well here. So assumptions, we always have assumptions, like what are we assuming? What are we expecting? Is it going to be fulfilled? And those are assumptions. It is assumed that governance is redistributed, and this is by O'Grady. And so Porter O'Grady is one of the best, one of the nurses who actually focused on governance, and he wrote more than 26 books. And even up to today, he talks about governance. And I'm sure that if you have stumbled upon or reading the book of O'Grady, you will see that there has been changes from shared governance in the 1980s and 1990s to what we call now professional governance. We presume that nurses want to participate in decision-making. The assumption is not validated according to Porter O'Grady. Why? Because do they really want to make decisions? Yes, we want nurses to make decisions, but are they prepared? Are they ready to make those decisions? And that is one of the assumptions. If nurses have the authority for decision-making, it does not necessarily mean that they choose to exercise it. And that is according to Anthony. But then again, when administration empowers nurses and prepares nurses through education and training to make decisions, they can and they will make decisions, but they also need that support from administration. So here I have a paradigm shift, since we always talk about, well, what changed? What shifted, right, from the past to the present? Well, not much, really, if you read about what shared governance was up to today. But there are some differences, because the paradigm shift is more of interaction. Is there enough communication? Is there enough interaction that happens between employees, managers, and the organizational systems? So these are the three layers where interaction really has to happen, and that becomes good governance. So in this slide, I stumbled upon a mixed method study, which I wanted to share with you. The study on governance, it is a quantitative, mixed methods, meaning they used quantitative and qualitative. The quantitative method used the Brazilian Nursing Workforce Index data, and the qualitative data involved interviews. You know, qualitative is more of interviews, right? And then you get the common themes. So there were 106 nurses, and the study title was Governance of Nursing Work Practice Based on Management of Nursing Care and Services Carried Out by Nurses. So in this study, we found out what were the findings, right? It was found that nurses perceived that they had autonomy, control over the environment, and also good relationships with physicians and organizational support for nursing governance. Very, very important. So can nurses make decisions? Yes, they can. Why? Well, they have the education, they have the training, and nurses go for advanced practice. They go for their graduate studies, like you are going for your PhD. People go for their DNP, people go for their EDD. So these are all advanced studies, and gives us, it empowers us to think critically and make decisions. But not only that, we need that relationship with physicians. Are they respecting our decisions? And in the same token, we also make sure that organizational systems support that decision making that we have. So implications for nursing practice in this particular study was to continue gaining organizational support. Nurses need management knowledge and skills. So even clinical practice nurses, those who are devoted into their bedside nursing supervision, they still need a lot of knowledge on management and skills so that they can collaborate with management. And so as we proceed, we will now look at the different dimensions. We have good governance involves the process and structures that provide autonomy, control, and authority to nurses regarding the nursing practices within an organization. So where do we have autonomy and control? Well, that depends on what your interest in nursing is. What did you focus on? What did your study focus on? Well, mine was more on education alongside clinical practice. I did ICU nursing. I did medical ICU, surgical ICU, critical care in CCU, and my last stop was cardiothoracic ICU, which I really enjoyed. I enjoyed all those ICUs. Then I connected that with my love for education. So I do have governance in my role because of my experience and knowledge in clinical practice as well as education, and both of them go hand in hand. So in education, I zeroed in on know the laws in education that govern your state. What is the requirement for nurses in your state? Earn specialty certifications. We know that nurses are in different specialized fields. And what do? They actually want to sit and pass the certification for their own field, and that gives them a validation of their knowledge and practice. And then they feel empowered, and then they gain that respect. Nurses have become competitive. They proceed with graduate studies. As far as the dimension of nursing practice, I zeroed in on specialized in chosen fields, make decisions, skillful in assessment and management, and collaborate with healthcare team. An example I can give you is one of my expertise is analyzing advanced EKGs. So at one time, I was paged in the hospital by the cardiothoracic surgeon. And when I came, I was wondering, I wonder why they paged me, what for, right? When I came, they asked me, what do you think of this EKG? And then they told me the findings of 4 physicians, 2 cardiothoracic and 2 cardiologists. And so they said, well, we heard you're the expert in the field. Can you give us your your interpretation? So I did share my interpretation with them. And that was really great. That meant that my knowledge of advanced EKG empowered me, and I gained the respect of the surgeons and the cardiothoracic surgeons and the critical care, the cardiologists rather, so that our theories and our assumptions and our decision on how the EKG looked was actually a collaborative effort, which was really great. In community nursing, we participate in global health and we are advocates. And you know about COVID-19, right? In New York, in the Department of Health, we have nurses who focus on advocacy, and they talk about or spend so many years on identifying tuberculosis surveillance. They spend time on tuberculosis surveillance in order to decrease the incidence of active TB. And then also the same nurses also focused on giving healthcare seminars virtually on COVID-19. I also got involved with a series of Filipino-American forum on COVID-19, which was virtually presented. And that is advocacy. So empowered to speak in public, very important. Work for government. A lot of them work for government, like the nurses who are involved with the Department of Health, and of course, participate in shaping policy. So we are policy makers, so we have to be involved with that. So I mentioned earlier process and outcome, right? So good governance in nursing practice. So you heard about ANCC. ANCC is American Nurses Credentialing Council. They have come up with a magnet culture, and a magnet culture will tell you that there are elements in magnetism, what makes a healthcare system superior over those who are not a magnet healthcare facility. And in a magnet facility, they have proven that through research, they apply best practices in nursing. So process and outcome is so important. So they published this in 2021. So the process was shared decision-making between bedside nurses and nurse leaders, includes these areas, including in these areas are resources, nursing research, evidence-based practice, new equipment purchases and staffing, part of the process. Requires active engagement throughout the healthcare system. So nurses meet, discuss what kind of equipment is available now for this particular assessment tool. So, you know, there's always a change in science and technology, and it's important for us to participate. So it can be challenging to nurse administrators and bedside nurses. And so when we are involved with the process, we need to know that it has to be smoother. It can run smoothly if we have the proper strategy, which involves planning, implementation, and evaluation. Just like your nursing process, right? Planning, implementation, and evaluation. So what is the outcome if all this process is carried out? Well, the outcome, first and foremost, is quality patient care and patient satisfaction. It creates a culture of positivity and inclusion, job satisfaction for nurses, and it shifts the focus from a top-down management, which I earlier mentioned. That style was the old way, right? Top-down management style, to a collaborative management style. And this is more professional. That's why we call it the professional governance method. rather than the top-down method. So good governance in administration will include accountability, effectiveness, a good handle on hospital policies, accrediting bodies and state laws. So we know that hospitals achieve accreditation from the state, accreditation from the Joint Commission, in order for people to trust the system and in order for the system to be the best. Ethical decision maker, attends to nursing practice issues promptly, supports healthy work environment. And you know, the elements of healthy work environment sprang from AACN, American Association of Critical Care Nurses. And those elements actually help in making the workplace a satisfactory one so nurses can stay. So because of healthy work environment, nurses function better and the units can retain them better. So work satisfaction is number one. Of course, you would always want to work in a place where you all get along, right? And that's what you call healthy work environment. Best management practices to support healthcare services and monitoring quality of healthcare. There's always a monitoring system. You cannot improve what you don't measure. Very important to know. We always measure, how did we do? How did we do in a code? How did we do with cost effectiveness? How did we do with nursing retention? That is so important. So let us measure our goals. So here, good governance in research. What is this all about? Well, researchers have to continue researching in order to shape policy. Gathering and analyzing data on issues that need to be researched, research results become best practices. Like, for example, I gave you an example where my dissertation, my research was on preceptor training. And what I did there is I measured 5 items, I measured 5 items where if preceptors were trained, what will be the outcome? So I found a significant finding in one, the nurses were very good evaluators. They knew how to evaluate their orientees. There was an improvement in interpersonal relationship, personality of nurses, teaching competence and knowledge. So the 5 items I measured actually proved statistically significant. And because it's statistically significant, now we can say that preceptors need to be trained before they embark into the role of precepting. And that is what we mean by research results become best practices. So other examples of best practices, the data that we get from research on catheter-associated urinary tract infection, that data has given us a reason not to catheterize all patients who go to the operating room. If it's a short surgery, they don't need catheters, right? Because we know that the use of catheters can lead to incidents in CAUTI. Wound infections, line sepsis, all of those have data. Wound care, and most importantly, I know it's a requirement for all of us that we have to know the advanced cardiac life support guidelines, which is based on research, which American Heart Association presents, and guidelines change every 5 years because of research. And that became best practices. And American Heart will not give us guidelines that did not come from research. So those are examples of how research can shape what we're studying and what can shape policy. And that is good governance. Okay, so let's move on to our next slide. We're almost there. So we have pillars. What are the pillars of good governance? So these are all the pillars: participation, rule of law, transparency, responsiveness, consensus-oriented, equity and inclusiveness, effectiveness and efficiency, and accountability. If we practice all of these elements, that becomes good governance in all the fields we were talking about. So the application, all of these pillars are applicable in nursing practice and in healthcare. So we have some pictures to show you. So, and then we have another statement from Dr. O'Grady. He says, principles of sustaining shared professional governance in nursing. We've been struggling with it for over 35 years. Why do we have inconsistency with this key to engagement, accountability, and professional practice? That's a big question from Dr. O'Grady. Why are we inconsistent when we already know that we have the principles? It's the start of a new year full of promise and hope. Let's vow to commit to professional governance moving forward. That is the legacy of Dr. O'Grady, who has talked so much about good governance. So in these pictures, I'm trying to give you examples now of good governance. Here, this is a classroom where I taught nursing students, not nursing students, these are nurses already, but they come to take courses. So I informed them about the research done by the National Institute of Health, and that is the All of Us research. And so they're involved with that. So informing them is very, very important because we want them to be research-minded, right? In order for them to always look for something to research and get involved with All of Us research, and which is the research done by NIH. And then I have this picture, one of my favorites. This is a picture during break time when I was in the ICN, International Council of Nurses in Seoul, Korea. I gathered, that's what I do. I gathered nurses from different countries. So this one is from Africa, and the other one is from Thailand. And we started comparing notes. What are the issues in nursing globally? And we talked about so many things. Just during the 20 minutes break time that we had, we learned so much from each other. And that is involvement, collaboration, right? The big C is collaboration. We talked about retention. We talked about the paycheck of nurses. We talked about shortage. The biggest issue is shortage. And it's worldwide. And it leads to burnout. So burnout, which is really bad because it can make nurses leave their profession altogether. So it's very important to attend conferences locally, nationally, and internationally because you will hear their views. And here in this picture, one of my favorites as well, it's a professional development of student nurses so they could make a difference. And it will teaching them what you need to teach them the best that you can. It will impact on quality patient care. I enjoyed that group. They were a fun group. And this one is myself during COVID-19 in 2020, where there was a big shortage of PPE. So I actually researched on who can provide PPE. I stumbled upon the U.S. Army, retired and active in the explosives division, and I actually asked them if they can provide PPE, and they said yes. We're making face shields. So they kept sending me face shields, and I distributed them to different hospitals and nursing homes in New York. And I was the president of the Philippine Nurses Association of New York at that time. Between 2018 and 2020 was my term. So you see the boxes here. These are full of face shields, which I have to mail out to different, in my home, in my living room. I have to mail them out to different nursing homes. And that is involvement, right? And here I am with my husband. And we went to Washington, D.C. to speak with lawmakers. Again, that is collaboration, this time collaborating with government so that we can make a difference in our profession. And most importantly for this trip was knowing that if I have a voice, as a nurse, I have a voice to speak up with the lawmakers, then I can actually be involved in shaping policy in nursing. So this was a very important trip. And I was supposed to go to the Philippines at that time. I actually cut 1 week of my vacation. Out of my 3 weeks, I ended up only with 2 weeks in the Philippines because my appointment to come to Washington, D.C. was one of the weeks where I had to go to the Philippines. So I cut short my trip to the Philippines to focus on shaping policy and discussing with lawmakers, and that is collaboration. So conclusion from me, education, administration, research, and clinical practice are all one in alignment as long as processes and structures involve professional governance, where nurses in all fields of specialty have the autonomy to control their own professional actions through collaboration based on their knowledge and expertise to make a difference in healthcare. That is what it's all about. Make a difference in healthcare. And what is that difference? Quality and safety in patient care through effective healthcare systems. So we are partners, we are involved in the healthcare systems because we collaborate. Okay? And with that, I thank you for your attention, and I thank you for inviting me to such an important event where you are going to learn something from me about good governance, and which we now call professional governance. Thank you so much. All right.
Thank you very much, Dr. Ortalis, for sharing your input and expertise regarding good governance in the field of nursing education. We will now proceed with the question and answer portion. We have collated some of the questions that the participants have submitted during the registration for this webinar. Here is your first question, Dr. Ortalis.
Okay, thanks.
Both academic education in nursing and continuing education of nurses are very important. What do you think is the biggest challenge facing governance in nursing education before and during the COVID-19 pandemic?
Thank you for that question. Well, the biggest challenge actually for nurses is time. They do want to, nurses are very competitive. They do want to proceed, they do want to advance in their profession, and they do attend seminars and take education. The only challenge, one of the biggest challenge is time. Well, COVID-19 was a big challenge, but they still tried to do it. But as far as time, the reason I'm saying time is because many nurses are suffering from the burden of short staffing. And there is about, from now up to 2030, there is going to be 1.1 million shortage of nurses in the United States and 5 million globally. So nurses really have been overstretching their time and efforts in working. But other than that, they are very competitive and they're very willing to study.
Thank you very much for that insightful answer, Dr. Ortalis. We have our next question. What makes a successful preceptor training program, and what advice can you give to our nurse educators?
Thank you. My advice to nurse educators is that they have, when they start a preceptor training program, they have to set realistic goals, and they have to make sure that adult learning theories are used in teaching, and also to emphasize to the nurses that their personality and their behavior as teachers really count, because we are teaching, you know, as I mentioned before, when we precept patients as nurses, it's a teaching moment. The teaching moment is very sacred, where it involves the teacher, the clinical preceptee, and the patient. So that's a very important teaching moment, and always to remember the nursing code of ethics as part of education. But yes, to me, you know, using the adult learning principles is very important and make them effective.
I agree with you, Dr. Ortalis, when you said that personality and behaviors as teachers really count. Thank you, Dr. Ortalis, for the valuable advice you have imparted us. Thank you to our participants for raising your questions. We hope that some of them were answered and clarified accordingly by our resource speaker. Thank you so much, Dr. Marie Antoinette Ordalis, for the very informative and substantial presentation and answers to the questions of our participants. We will see you later in the awarding of certificates.
Thank you for having me. It was an honor.
Thank you very much, Doctor. Now, it is time to meet a very popular public figure in the Philippines and an expert in the field of nursing. May I call on Ms. Mary Ann Neri, Assistant Professor and Lecturer at De La Salle Lipa, Central Escolar University Las Piñas, and Pamantasan Lungsod ng Pasay, to introduce our first inspirational speaker.
Good morning, everyone. Our next inspirational speaker is the chairman of CEB Group of Companies, which includes review centers all over the Philippines and abroad. He is the president of Asian Academy for Applied Entrepreneurship and director of Spotlight Artist Center. He is also a movie producer. He released in 2007 the film NARS, and in 2017, the film Maestra. As an advocate of entrepreneurship, he is a familiar trainer at the University of the Philippines Institute for Small-Scale Industry. He graduated his Bachelor of Science in Nursing at University of Santo Tomas. He took his Master's in Nursing and Doctor of Education in Pamantasan Lungsod ng Maynila. He also finished an executive program in international management from Stanford University and National University of Singapore, and earned a certificate in entrepreneurship from De La Salle University College of St. Benilde. Currently, the president of Philippine Chamber of Commerce and Industry, a Filipino entrepreneur, reviewer, movie producer, and an educator. Please help me welcome Dr. Carl E. Balita.
Receiving the highest honors among 50 top executives all over the world. He finished the executive program in International Management in Stanford University and National University of Singapore, and a certified franchise executive graduate in the Philippine Franchise Association. He holds 3 professional licenses, a master's degree and 2 doctoral degrees in humanities and education. He is currently working on his 3rd doctoral degree. He is the man behind the biggest review center in the Philippines, the Dr. Carl E. Balita Review Center, or popularly known as CBRC. It has more than 120 branches spread across the Philippines and other parts of the world, including Asia, Middle East, and Canada, and has the distinction of being the first ISO 9001 2015 certified business of its kind. CBRC dominated the Philippine Franchise Association's Franchise Excellence Awards in 2017 and 2019, winning most of the prestigious awards. It is the leader in innovation for its online review and training today, making its way to becoming a global institution of excellence in knowledge development for lifelong learning. He owns the Mahalta Resort and Convention Center and the Pedagogy Learning Center. He is a film and record producer, a best-selling author, and a Hall of Fame awardee as host of ABS-CBN DZMM's Radyo Negosyo for almost 2 decades now. A fellow of Royal Institute of Entrepreneurs in Singapore. He is a respected and multi-awarded businessman, being awarded the Asia CEO Entrepreneur of the Year Circle of Excellence for 3 consecutive years, an outstanding professional awardee in 2018, Asia Pacific Young Entrepreneur Awards finalist, DOST Science Ambassador, University of Santo Tomas Total Awards recipient, and Oriental Mendoros, the Mahalta Award Entrepreneur. He is the chairman of Philippine Chamber of Commerce and Industry in Quezon City, and its current national chairman for Human Resource Development. An international motivational speaker, a business professor, and more importantly, a family man. The educational entrepreneur extraordinaire, Dr. Carl E. Balita.
Magandang umaga sa inyong lahat. Good morning.
Good day to anyone overseas or elsewhere in the world. This is a beautiful day indeed. I was listening to the beautiful lecture of Dr. Artalis. Congratulations. It's really beautiful. I took down notes myself and I loved hearing from you, especially in the areas of governance or good professional governance indeed. Of course, my purpose my agenda or the intention of the organizing committee to have me here is probably related to what I applied for in this country, daring to be the first nurse to run in the Philippine Senate, the only teacher in the list, the only midwife in the list, and the only micro, small, and medium enterprise advocate amongst the candidates that you had in the last 2022 elections. I would say that my experience was all worthwhile. The success does not come from the destination only, but it may actually come from the journey, which in my case, as far as I'm concerned, it's our journey always worth taking and the journey that I will forever cherish in my life. With 4 million votes, ang kapatid po ninyong nurse was trusted by such a number of people. That's minus the fact that some of them may, I believe that there's more. I really believe that there's more. You know, being a nurse in the campaign trail over 8 months of my life made me realize that indeed nurses have to do a lot of things, not only for itself, not only for nursing, but for the society where we live in. And this is where governance will come in. I applied for that position. I offered myself to the Filipinos with very limited resources as compared with my competitors who spent billions of pesos to win. I wouldn't have that billions, nor would I be willing to spend several millions only to win because I know what it would mean in my governance. You see, as I saw the ground, by the way, I'm writing an article or towards a book about T-shirt. And let me share with you about the T-shirt. You know, T-shirt is the title of that article in that book because T-shirt is what many Filipinos would ask for from a candidate in the campaign trail. There was even an instance na sabi niya, T-shirt. Sabi ko, wala po akong T-shirt. Sabi niya, hindi kita iboboto. Sabi ng isa, T-shirt. Sabi ko, wala po akong T-shirt. Sabi niya, pwede candy na lang. So we're talking here of governance in the big picture of the country we love, the country that made many of us stay, and the country which is the only one we have in our lifetime. But you know, looking at it, I am more challenged that nurses should shift its paradigm from being apolitical to being political. And that was even the challenge I gave the Philippine Nurses Association, which did not come out openly to say that the PNA supports Carl Balita, the first nurse to run in the Philippine Senate. And by the way, I did the decision to run on consultation with many nursing leaders, asking myself, even the medical groups, because they were my pushers to run, I asked them, is there anyone else? Is there anyone else I can just support? The way I supported a party list before. I mean, is there anybody else? Because I was not in the mood to run as I was, surviving my company in the middle of the pandemic. And that they said, no, there's no one else. Even the doctor said that. And I said, okay, I will dare run if that's what you want, but I need your support. But mind you, not many nursing organizations came out because of their fear that they needed to be apolitical. And I'm saying this to you because if we want the power to change, then that power would come from our willingness to immerse ourselves to the power in politics. And I am taking active role now. That's going to be my resolution. After failing to get a seat in the Senate, I will continue to push for nurses in politics. Do you know that not many nurses who run actually won? Do you know that our very own chairman, Dr. Pugoon, ran as councilor in in her municipality where she served many years of her life, but she lost. Do you know that one doctor nurse in one city also ran for councilor, who actually throughout the pandemic gave himself in the service of the people there, and he still lost. And do you know that when I declared to run, and when I filed my certificate of candidacy in the COMELEC, in the COMELEC website itself, someone asked, sino siya? Hindi ko kilala. I don't know him. And somebody said, hey, he's Carl Balita. He is a nurse. You know what someone said? Oh, nurse lang pala. Bakit ang lakas ng loob? Alam mo, sa totoo lang, I was looking for that person, but I just missed it. Maybe the person deleted the comment because that is how they see us in the public. And we're talking even of good governance. We're talking about consistency of the quality, the safety, as we have heard it from Dr. Antolin. But in our own very country, which creates the best nurses in the world probably, and which created the heroes of the pandemic, there are questions about what we can actually do in the level of governance and in the level of policy making. I was sad reading those, but I was more sad when one campaign expert approached me and said, Carl, pwede bang mas i-highlight mo yung pagiging teacher mo? Because I hold 3 professional licenses. Pwede bang mas i-highlight mo yung pagiging teacher mo in your campaign rather than pagiging nurse mo? And I said, why? Alam mo sagot niya? Kasi alam mo naman sa Pilipinas, pag sinabi mong teacher, powerful. Pero pag sinabi mong nurse, and you know what followed his statement? Because the old paradigm of what nurses do in the bedside is still there. Is it the society's fault for seeing us that way? Or is it our fault for not showing them actively enough who we are and what we can do? These are questions I want to ask you. Yes, you're getting your PhDs. You will be doctor somebody sometime soon. But this very doctor in front of you right now ran in the Senate representing the frontliners in healthcare and the frontliners in learning and the frontliners in the economy, in the micro, small, medium enterprise side of the economy. Lost. I am happy with the number of votes that I got, but I thought and I felt that Filipinos who may have heard that a nurse was running, a teacher was running, would have chosen us. I don't know if it's about me being a neophyte or it's about us being in the quandary of how people actually choose and in the middle of vote buying and so on. But I'm making a wake-up call that nurses should start activating itself in the world of politics. Even Florence Nightingale was a politician. Even the American Nurses Association is very active in politics. And that's why I don't want nurses to be kneeling in front of senators who barely understand healthcare and nursing so that they can give us what we deserve in this very country we serve. I've been witness to how we bended our knees in front of powerful politicians just to ask for the salary grade 15, which we rightfully deserve for many years already. If we want to talk about governance, we talk about ourselves and we talk about our organizations, our advocacy groups, our individual circles, so that we can cascade that power to make a difference. It's all about making a difference, as Dr. Antolin mentioned. But let me put it this way, just to put summarization into what I want to say is, I want paradigm shift not only towards good governance. I want paradigm shifts in some areas of our lives, in the way we operate. Number one, the shift from education to execution. Education shifting to execution. Because the proof of learning is change. If we are so learned already as professionals, then we should already feel that change. Somehow we feel the change though. But execution of what theoretically we know and what educationally we achieve should bring about that execution in the workplace where we live to bring about that change that should happen. The second paradigm shift is from management to leadership. There's just too much management and too little leadership. And let me prove to you that leadership is what we lack, because it's leadership that bring about change. Managers like the status quo. Managers like, like efficiency. They measure for efficiency. But leadership wants effectiveness. Leadership takes risks. And leadership brings about change. And if indeed there is leadership in our midst, then how come change is slow and influence is weak? I'm posing all these questions. I want you to be inspired towards action. And that's why I want you to take execution. I want you to take leadership. The third is profit shifting to strategy. Profit shifting to purpose, rather. To purpose. Organizations are so profit-driven that they forgot about their purpose. Even running in government, running in positions is so profit-oriented that the purpose to serve is gone. Maybe even your pursuit of your education is so self-centered for the purpose of profit, which is promotion, which is higher salary, rather than purpose of bringing about that change. These are all challenges I want to impose on the conversation today on good governance. Number 4, the shift from strategy to sustainability. We have all become so selfish to look at only strategies that will make us survive and thrive. But we forgot the whole picture of sustainability. Even the world needs to talk about it. Sustainability of Earth itself is a big, quiet conversation in many areas where we operate. The simple waste disposal in our organization sometimes is even a big issue, and we want strategy rather than sustainability. Ladies and gentlemen, I would like to summarize the 4. How do you want to see a shift from education to execution? How do you want to see a shift from management to leadership? How do you want to see the shift from profit to purpose? How do you want to see the shift from strategy to sustainability? And in closing, it can be done if we take different perspectives. Different perspective. And I leave you with another 4. First is circumspective. We have to be circumspective to see things around us, to see how we are seen, to show them who we really are, to be circumspective, to get feedback from them. Ang problema pa rin, sabi ko nga, bakit ganun pa rin ang tingin sa atin, tagasunod sa doktor? Tignan nyo nga pag nagra-rounds ang doktor, nasaan tayo? Di pa talagang nakasunod tayo sa doktor? I mean, let's get real. I got this from Dr. ARB, Dr. Borromeo himself, who said that, what really are we showing anyway to the people around us, making it so difficult for us to get out of that box that nurses follow doctor's order? Because really, we're there during rounds quietly observing what doctors will tell the patient and quietly listening to the instructions of the doctors who sometimes would give the instruction on what we will do in front of the patient. Think about it. It's really about being circumspective and looking ourselves from outside in so that we can somehow show them who we really are, because we are more than that. And we know that. I am more than just a nurse wanting to run. I was a nurse wanting to offer myself in the service of the Filipino people because I'm qualified for it. I'm probably one of the most qualified, as they say. The second is we have to be retrospective. We have to go back. We have to look back because the distance by which we can travel forward is only proportionate to the distance that we can look back. And you know, I love Dr. Antolin starting off with Florence Nightingale, making us look back to the Crimean War, where she excelled and showed herself as a leader, not only as a manager of healthcare. So circumspective, retrospective, and the third is prospective. We should be visionary enough to be able to see the future, the ideal future much ahead, and with some risk-taking capability as we live our precious present moments. So aside from being retrospective, we have to be prospective. Prospective in the sense that we want to look forward. Ladies and gentlemen, the fourth of them all is being introspective. We look within. Let's look within on how we govern ourselves and how we apply governance in our lives. I congratulate you. We're pursuing higher education. We're lifelong learners. I'm enrolled for my third doctorate degree. You're finishing your PhDs. Dr. Antolin is an expert. The thing here, ladies and gentlemen, is how many are out there like our kind. And when we become introspective, we tap the power within and unleash it so that we can make a difference. A nurse once said, I'm a nurse. I'm a global citizen. I will change the world. And she was 20 years old when she said that. And somebody said, I'm a nurse. I'm changing the world. Celebrating 21, 22, 23, 24, and so on. Oh my God. She went 30 years old and she said, I'm a nurse. I'm 30, I'm gonna change the world. I change my country. And she started changing her country, 31, 32, 33, 34. And when she was 40, I cannot change my country. But I can change my community. Life begins at 40, and she changed her community. And 41, 42, 43, when she was 50, she said, I cannot change my community. Maybe I can change my family. And she started changing the family. And she spent 50, 60, 70, 51, 52. And when she was 60, she said, I cannot change my family. Maybe I can change myself. And then that person realized that if at 20 I started changing myself, maybe I would have changed my family, maybe my family would have changed my community, maybe my community would have changed my country, and my country would change the world. Ladies and gentlemen, it's a wonderful day talking about good governance. It's a wonderful day talking about listening to the expertise of other participants. I am actually bound to stay. I love you, Dr. Ortaliz. Did I read it right? Yeah. Thank you very much for the beautiful lecture you gave us this morning. But let me show you the perspective I'm taking as your kapatid, as your brother in the campaign trail, seeing not only the situation of our fellow Filipinos, but also seeing how they see nursing from their point of view, and really challenging you to take some risks in being part of where you can influence. I did not lose. I actually won because I already, echoed the message of nursing, the message of healthcare in every stage I stepped on, in every forum I joined in, and in every conversation I have had. I have always carried the message of what nurses are, what nursing should be, and how they should be looking at us, not only as professionals, but as change agents, as leaders, as policy makers, as researchers, as educators, simply as people who can make a difference. God bless you all. God bless Philippine nursing. God bless nurses in the world. And God bless everyone. Thank you very much.
Thank you very much, Dr. Carl Balita. We are truly grateful for your presence. Thank you for elevating the nursing profession and for your continuous support to all our nurses and, of course, future nurses. So to my fellow colleagues, to my fellow nurses, remember, as leaders, we can be change agents. Remember, we can change the face of healthcare. We can change the world. Thank you once again, Dr. Carl Balita. And now we move forward to our next resource speaker. I hope everyone is thrilled to learn more about our topics for today and to give more elaboration and understanding of good governance in public health nursing. May we call on Ms. Mary Grace Abal, nurse entrepreneur, nurse practitioner, and a faculty member of St. Joseph College of Cavite Incorporated, to introduce our next resource speaker.
Good morning, everyone. Our guest speaker is an epitome of excellence who values science as a pursuit of our abilities to think and to reason, and believes that this ability is always secondary to our grace of faith. Born of Italian descent and raised in Europe, our guest speaker entered UCLA following his Maturita Scientifica high school degree. He obtained his bachelor's degree in 1975 in 3 years and began working in the Mental Retardation Research Center as a laboratory helper first, then a laboratory assistant, and eventually a senior staff research associate. He later obtained a master's degree in research methodology and statistics and eventually his PhD in 1986. Upon completing a dual postdoctoral fellowship in fundamental and clinical immunology and psychoneuroimmunology, he accepted a tenure track position at the UCLA School of Dentistry, which he served for over 2 decades on the faculty and as vice chair. He also taught in the Department of the Health Sciences, California State University, Northridge for the last 4 years of his active academic endeavor. During his academic career, he administered sizable research budgets, mentored several students to the graduate degrees, published over 200 peer-reviewed research and review papers in his field, and several book chapters and academic books in his field of scientific expertise in immunology and psychoneuroendocrine immune interactions and evidence-based healthcare. He received several honors, among which the principal ones for his contribution to the science of evidence-based healthcare are the Honorary Clinical Doctorate degree, International Fellow of the British Society of Medicine, Fellow of the American Association for the Advancement of Science. He is also one of the few overseas fellows of the Royal Society of Medicine and a Fulbright alumnus. He also received honors for his services towards shared governance by the UCLA Senate in 2016. Since his retirement, our guest speaker enjoys writing novels, walking his dog, and caring for his herb garden with his lovely wife, Dr. Olivia Cajulis Chapelli. He may claim to have retired and left science behind, but his leadership in comparative effectiveness research continues to play a timely and critical role in improving modern healthcare by improving the science of obtaining, disseminating, and utilizing the best available evidence for the benefit of all patients. Although he may have retired as full professor emeritus in 2018, he continues to collaborate widely across the world, in part through the evidence-based decision practice-based research network he founded and directs, from Europe to Australia, from Brazil, and now to the Philippines. His academic expertise, besides fundamental and clinical immunology and psychoneuroimmunology, include biostatistics, meta-analysis, systematic reviews, research synthesis, and evidence-based research in medicine, dentistry, and nursing. Our guest speaker views our role in this life as humble instruments to the greater glory of God. According to him, a person can be a good and sound scientist while remaining true and committed to putting Christ at the center of it all. He views our role as humble instruments to the greater glory of God through and in with Christ at Majoram Dei Gloriam, and thus today we are thankful and privileged to have our guest speaker who has been a scientist all of his life, become an instrument for us all during this webinar as he imparts his vast knowledge and experience in the fields of good governance for all of us. It is with my great pride and honor, ladies and gentlemen, please join me in welcoming Dr. Francesco Ciappelli.
Good morning. It is my pleasure and my honor to participate in this webinar on shared governance in healthcare. I want to thank Gracie Sabal for her kind introduction, and I will encourage you to contact me by email. My email is on the first slide that I present today. Contact me by email if you have any questions or any issues throughout your work that pertains to evidence-based nursing, evidence-based healthcare. So here we go. As we begin, I must stress that during the last 15 years of my academic career at the UCLA Center for the Health Sciences, my research interest focused on how we obtain and disseminate the best available evidence for evidence-based healthcare. Today I will cover this field in an introductory yet in-depth manner to some extent at least. To do that, I will first explain the difference between healthcare based on the evidence and evidence-based healthcare. That's point number one. Next, I will discuss the protocol, the tools, the method to obtain the best available evidence. That's point number two. Point number 3 and 4, I will conclude this presentation by exploring two examples as they pertain specifically to nursing in our times of COVID. I have provided Gracie Sabal with a third paper example, which you might want to peruse on your own as a training exercise of the material we discussed today. The advantage of that third paper is that it was written by faculty members at the University of the Philippines. In other words, you have experts in the area we discussed today right in your own backyard, as one might say. Well, let us get started with no further delay. So my second slide shows a situation of misinformation and healthcare based on the evidence. So first, let me be clear. The performance of healthcare must rest and does rest in all developed societies, in most cases nowadays, on scientific evidence. Certainly, you may run across nonsense such as this. Root canals lead to breast cancer. Absolute nonsense. But fortunately, it is rather uncommon. It still can occur. And it occurs sometimes in situations that are more critical. such as in the case of the horse antiparasitic agent ivermectin, which was recommended by some physician to treat COVID up to about a year ago. Of course, the ludicrous suggestion that root canals may lead to breast cancer is very different from the last life-threatening recommendation of a totally ineffectual remedy for a life-threatening disease. Yet both cases mirror the same problem: healthcare intervention based on one or two or a few handful of reports of scientific evidence with no concern or attention to whether or not these reports are sound and to whether the evidence is at all good, reliable, and valid. That is, we call that type of healthcare based on the evidence. It is a thing of the past which must be left behind because it is dangerous to our patients. Well, what do we replace it with? We replace it with, as the title of this third slide says, evidence-based healthcare. That is, in brief, healthcare intervention that utilizes as its foundation the consensus of the best available evidence. And that is, ladies and gentlemen, the key words of the entire presentation today. The consensus of the best available evidence. This is what we explore today, how to obtain the best available evidence, and in which case can we talk about the consensus of the best available evidence. So evidence-based healthcare results from the synthesis of all available research evidence and the extraction of the best, most reliable, valid findings. It is the product of a stringent process of investigation whose design we call research synthesis. So research synthesis generates a specialized report that we call the systematic review. So the systematic review identifies and highlights the optimal effectiveness of treatment. Therefore, it is also called sometimes the comparative effectiveness report. So in reference to ivermectin, again, the example we used in the previous slide, a recent systematic review left no doubt whatsoever that this drug has a low certainty of outcome safety and overall efficacy in the treatment of COVID. By the way, this particular systematic review was produced by the Cochrane Association. The Cochrane systematic reviews are always the best comparative effectiveness report you can find, by far. So well then, how do we do? How do we read? How do we interpret a systematic review? Now, on this slide, we see an example, a reference on how we go about the elements of the PICO question, how we refine the PICO questions, how we produce keywords and mesh words, and generate this particular analytical framework. So here we see that we're looking at patients with cystic graft fibrosis, and we are looking at intervention with growth hormone, and we have issues that come out of our thinking about these PICO questions, such as adverse events, intermediate outcomes, that we might want to examine in further detail. And each of these will generate specific key questions and keywords. For example, adverse events of altered glucose levels, or diabetes, or lymphopenia, or malignancy. And we can use these keywords and these mesh words to further refine the list of papers we obtain from these three databases I was mentioning. So here we have, in this slide, the process of cleaning up, as it were, this list of literature that we obtain. So the sample of the research synthesis is all of the available peer review findings. And that starts in the table that is on this slide with 17,000 plus citations. Now, some are eliminated because they are duplicates. Some are eliminated because they are not really pertinent. Some are excluded because the full text is not available, or maybe they're not in English or not in Tagalog, and for a variety of other reasons. What remains is the data of 102 studies. So remember, we started with 17,800, almost 18,000, and we end up with 102 studies. Those 102 studies are what we call the bibliome, the collected literature refined through this PICO question. It is not rare that the result, the bibliome, could be as low as 5 or 10% of the initial number of papers obtained. It is not rare, so when you do your systematic review and you get to that point and you realize, my God, I only have 102 studies, that is actually normal. That is actually reflecting the fact that you have done a proper process of cleaning up the available literature. Now, on this slide, we see an example, a reference on how we go about the elements of the PICO questions, how we refine the PICO questions, how we produce keywords and mesh words, and generate this particular analytical framework. So here we see that we're looking at patients with cystic graft fibrosis, and we are looking at intervention with growth hormone, and we have issues that come out of our thinking about these PICO questions, such as adverse events, intermediate outcomes, that we might want to examine in further detail. And each of these will generate specific key questions and keywords. For example, adverse events of altered glucose levels, or diabetes, or lymphopenia, or malignancy. And we can use these keywords and these mesh words to further refine the list of papers we obtain from these three databases I was mentioning. So here we have, in this slide, the process of cleaning up, as it were, this list of literature that we obtain. So the sample of the research synthesis is all of the available peer review findings. And that starts in the table that is on this slide with 17,000 plus citations. Now, some are eliminated because they are duplicates. Some are eliminated because they are not really pertinent. Some are excluded because the full text is not available, or maybe they're not in English or not in Tagalog, and for a variety of other reasons. What remains is the data of 102 studies. So remember, we started with 17,800, almost 18,000, and we end up with 102 studies. Those 102 studies are what we call the bibliome, the collected literature refined through this PICO question. It is not rare that the result, the bibliome, could be as low as 5 or 10% of the initial number of papers obtained. It is not rare, so when you do your systematic review and you get to that point and you realize, my God, I only have 102 studies, that is actually normal. That is actually reflecting the fact that you have done a proper process of cleaning up the available literature. In the next slide, we see that when we obtain the consensus of the best available evidence, then we can update and revise and reevaluate clinical practice guidelines. So we now generate evidence-based clinical practice guidelines, and our duty now is to disseminate, and we disseminate these evidence-based clinical practice guideline by means of, yes, the systematic review report, as the little schematic representation shows in the center, schematic report. They will produce executive summaries. They will be posted on websites. They will be generating clinical clinician guidelines. They will be translated in lay language for the patients, for consumer guides. They will be translated, in a sense, to language that insurance companies like to use, so that they will become policymakers' summaries and will be integrated, hopefully, in the reassessments of what insurance company cover and don't cover. They will be producing comparative effectiveness modules, interactive case studies. All of those will be helping the clinicians on a day-to-day. They will be generating faculty slides, such as what I'm presenting today and what is also available through the AHRQ. As you visit the link of AHRQ, you will see there is a section where they have prepared slides for the dissemination of the material that we're discussing today. They will be also presented as information material for the patients, pamphlet and consumer guides. Now, it may be the case that several of the studies in the bibliome have good and sound data that are related and that therefore could be and maybe even should be pulled together. If you remember your introductory statistics, you will remember that the larger the sample size, the greater the power of a study. And the power of a study is the certainty to find an effect if there is one to be found. So if you have several studies that are coherent, that are related, that are what we say in statistics homogeneous, then those can be pulled together and they will you will therefore increase the power and you will increase the certainty of the finding the effect. So it is to your advantage to pull together studies if they are homogeneous. But step number one must be to first establish that the data reported in the individual studies are in fact related, that they are in fact homogeneous, and they are in fact exempt from publication bias. And step number two, when we can do that, then the individual studies must be providing you with the elements that you need to pull them together. That is, the means and standard deviations or the risk ratios, not only for the experimental values, but also for the control, so that you can actually do what we call an effect size, which is essentially, to keep it simple, is treatment minus control, is the results of what is found in the experimental group minus the results of what is found in the control group. That is essentially the effect size. That is what is used in meta-analysis. So here we see in this slide how homogeneity is calculated. It is calculated very simply by this I-square statistics, which, very simply stated, is the proportion of variation across studies. And we see that homogeneity can also be visualized by means of the funnel, the inverted funnel scatter plot, which simply looks at the spread of a treatment effect versus a study size. And that determines whether there is publication bias. Now, if you have established homogeneity and you want to pool studies together, then, and you have studies that present both the control and the experimental values as, for example, means and standard deviation, or risk ratio, you can compute the effect size and its extent of variation. And you can plot the data for each study. So here on the insert, you see essentially 5 studies. These 5 studies are represented as symbols, closed symbols. The size of the symbol represents the weight, the relative weight of the study in the overall analysis, and that is given by its sample size. So the last study, for example, has the largest closed symbol, and therefore it has the largest sample size. It has the largest weight in the overall analysis. The second study, for example, has the smallest closed symbol, and therefore it has the smallest sample size. The position of the symbol is essentially the normalized mean effect. That is, it's essentially the effect size. It's essentially the difference between treatment and control, the position of that effect size. That line that traverses the symbol is the 95% confidence interval. It is the notion of the variation, okay, of the overall standard deviation of that effect size. So again, if you look at the last study, the largest closed symbol, it has the smallest line, meaning that all the data in that study are very tight together. There is very little amount of variation compared, for example, with the second study that has the smallest symbol, closed symbol, but it has the longest line traversing that symbol. That means that it has a small sample size and it has a large extent of variation. This is how you read the forest plot. And you have this line that traverses the very last symbol on that insert, which is an open symbol. That open symbol is the overall effect size. That is the effect size calculated by the computer based on those 5 studies and their relative variations. The size, the overall size of that symbol indicates its own degree of variation. So you see, in this case, its own degree of variation is relatively not that larger than the 5th study, the study with the largest square and the smallest variation. And that is why, that is the reason for that is the fact that the 5th study, the largest sample size, is the one that has contributed the greatest to this open symbol overall measurement. And that last study had not only the largest sample size, but also the smallest variation. So the overall symbol, the open symbol, falls more or less where that 5th study falls, and it has essentially more or less the same variation as the 5th study. That line that passes through the middle, that dashed line that passes through the middle of the open symbol is called the reference line. Essentially the line of reference, so that you see that the first study has a much lower effect size than the line of reference, whereas as I said, the 5th study falls right on top of that line. This is to say that the forest plot is a very informative plot. It tells us a lot about not only the individual studies, but also the overall studies. And therefore, it needs to really be drawn on the basis of homogeneous studies. If you realize that if the 4th and the 5th studies were not homogeneous, they essentially would cancel each other. If the 4th study was a low quality study, it essentially would poison that entire analysis, as we will see in the next slide. So in the next slide, here we are integrating the criterion of evidence quality into the meta-analysis. So in the upper group of meta-analysis, we have high quality studies. We have 3 high quality studies. And again, you see that the symbols are, for the individual studies, are rectangles or squares, and which is different than the overall symbol, the 4th symbol from the top. You will also see that if you look at the moderate and low quality studies, those are 3 studies, and they fall very differently. They fall very differently, and the overall moderate and low subgroup quality studies, that overall not only has a much larger spread, but also it falls in a totally different position than the high subgroup overall. That is the 3rd symbol. If you are looking, I'm comparing the 3rd symbol to the 8th symbol. And this is telling you that if you have bad studies, low quality studies, they will bias the meta-analysis and render the meta-analysis essentially not informative at all. When you are pulling together the moderate and low quality studies and the high quality studies, you obtain the very last symbol on that insert. So that dashed line passes through that symbol. It is the reference line. And you can see very clearly how the high quality overall assessment falls on one side of the reference line, whereas the overall moderate and low quality studies fall on the other side of the line. So in a sense, it is as if you were doing a fruit juice and you put in one piece of rotten fruit. That one piece of rotten fruit will spoil the entire thing. And this is what this slide is showing. When you have 3 low quality studies, it spoils the whole result of what you could have obtained with the high quality studies. So when we do a meta-analysis, it is essential that, number 1, the studies be homogeneous. Number 2, it is essential that the studies give you a mean standard deviation or risk ratios for both the control and the experiment, so that you can obtain an effect size. And number 3, it is essential, critical, that we establish low quality studies and we eliminate those low quality studies, so that we do our meta-analysis, a quantitative assessment of the best available studies, only on the best studies. That is the principle. Now what you will find is that many systematic reviews have no meta-analysis. You will find several meta-analyses that do not follow the criteria that we just described, the AHRQ criteria of a systematic review, that is formulating a PCOTS, going through the cleaning up of the sample to the bibliome, going through the analytical framework. So you will have excellent meta-analyses that do not follow the criteria of the systematic reviews. You will have excellent systematic reviews that do not have meta-analyses. The optimum, of course, is what we're discussing today, that is systematic reviews that integrate meta-analyses. However, there are some excellent papers that are systematic reviews without meta-analysis that are purely qualitative. One such excellent paper is the paper produced by Ramos and colleagues, which I mentioned earlier in my presentation today. These investigators are, as I said, in the University of the Philippines. So they are right in your backyard. They studied the best available evidence on the efficacy and the safety of UV radiation for sterilization during this COVID pandemic. I have provided you with that paper, and I strongly recommend that you peruse that paper after this webinar. I recommend that you do that as an exercise. You will not find a meta-analysis, so there will not be any statistics, and it will be a safe ground. But it will be very informative as to how to go through the literature, the bibliome, the analytical framework, and obtaining qualitatively at least the best available evidence. Now, the papers I have I provide you today as an example, and that we will briefly look at now, combine both systematic review approach and the meta-analysis. You can read them at your leisure, but I have a few slides here to guide you in that reading. So let's start with the PAPA paper. You will see from the paper, you will see the elements of the PICO question, of the PICOS question. They will not be addressing the timeline and the clinical settings, so we're only talking about the PICO question. The population, the P, will be assessed nurses that are working in hospital across several countries. The intervention is more an exposure, but we are calling it intervention because it's an exposure intended as prevalence of mental health outcome, consequential to taking care of COVID patients. The comparator, again, the comparator is a comparator control. It's not really a comparator because it's an epidemiological study, but they call it a comparator in that sense. The outcome is the prevalence of anxiety, stress, depression, PTSD, insomnia, and significant risk factors of mental ailment in the healthcare staff. Then here I have an inset of their bibliome and how they have defined it, how they have defined each step, the identification, the screening, the eligibility, and eventually what was in the studies that were included. So their first identification was 1,562 papers, and they end up with 26, both in their qualitative and in their quantitative assessment. They eliminate the duplicates, they eliminate for a variety of reasons, but they end up with, so 26 are included as their bibliome. They call it the PRISMA flowchart. I should clarify what the PRISMA flowchart is. PRISMA is a tool that you can find in the literature, which essentially establishes the quality of systematic reviews. PRISMA is an acronym. It is derived from the CONSORT, which is also an acronym. The CONSORT is a tool that was devised to establish the quality of the randomized controlled trial, and that was expanded to looking at the quality of systematic reviews, and it's called the PRISMA. The PRISMA establishes the criteria to obtain the bibliome via a flowchart with the elements that Papa et al. Integrate in their studies, that is the identification of the literature, the screening, the elimination based on the eligibility, and finally what is included. Now they have then look at both the level and the quality of the bibliome. So the level is, well, they only look at epidemiological studies. The quality is based on this Loney criteria for observational studies. There are different tools around available in the literature to establish the quality of studies. So in this particular type of studies, they have used the Loney criteria, which have 8 items, looking at the random sample of the whole population, the unbiased sampling, the adequate sample size, the standard measures, the outcome measured, and the adequate response rate, confidence interval, and of the study subject described. So as I say, this is their choice as investigators. They have established the level quality that way. And there are different ways. There is an entire domain of the literature that pertains to looking at the strength, the reliability, and validity of instruments looking at or designed to look at the quality of the evidence. But this is not the topic today. Today we simply identify the fact that yes, they have looked at the level of the evidence, and they have looked at the quality based on the criteria that they have chosen. Now here they produce meta-analysis. Size that they're looking at. And this can be easily seen by the forest plot, because you have many studies that are on one side and many more studies that are on the other side of that frame of reference line. And several studies have a rather long line stretching across the symbol, meaning that they have themselves a large degree of variation. So the studies were not very clean statistically, and your overall anxiety prevalence is also not very clean. Clean meaning it has a large degree of variation. They do another meta-analysis to look at the prevalence of stress, and here we have exactly the same situation. We look at the overall symptom traversed by that red dashed line, the line of reference. We see that the symbol is quite stretched out, meaning that you have important, considerable studies on one side, or considerable sample size on one side, versus considerable sample size on the other side, stretching the overall statement. And you can see the forest plot easily based on that. The last meta-analysis that they present is on depression, and here you have exactly the same situation. You have many studies, yes, but you have a bunch of small studies with a large degree of variation. You have a few larger studies with much less variation. However, they are positioned on both sides of the line of reference, and therefore they contribute to that stretching of the overall. So based on that, you can say that, yeah, there are some effects of COVID on nurses, but it is not quite clear. They state that, yes, there is a consensus of significance evidence of the deleterious effect of COVID on the psychological health of nurses, in particular manifested as anxiety, stress, depression, PTSD, and insomnia. This is more qualitative than quantitative. The important differences in prevalence of mental health among nurses working in the front line of with COVID-19 patients across different demographic groups. So again, this is more qualitative. It is something that you read in the text of the individual studies, as opposed to the meta-analysis. And whereas no significant difference among subgroups based on gender, males or females, or marital status, there seemed to be significantly higher prevalence of depression in female nurses working with COVID compared to males. Now, none of those conclusions actually derive from the meta-analysis as we have just discussed them. Because these meta-analyses, as we said, have so much variability, so much variation within them, that the overall statement, the overarching analysis is rather ambiguous. Qualitatively, however, Papa et al. Are able to say that yes, there is a deleterious effect of COVID on the psychological status of nurses working with these patients. Varghese et al. Again, we can follow their studies in the same fashion. The study purpose states that they want to examine the best available evidence of the effect of COVID on the mental health of healthcare workers, with emphasis on the prevalence of anxiety, depression, or insomnia. So you can deduce a PICO question that sounds something like: population is the healthcare workers, intervention is caring for COVID patients, comparator is none, again it's an epidemiological studies, the outcome is the prevalence rates of depression, anxiety, and insomnia. So this Varghese paper does not present a PICO question as clearly stated as the Papa paper, but the two questions are related, they are homogeneous, they ask the same question. The Biblio is done in the same fashion. The identification, the screening, eligibility, and what is included, you can see that derives also from the PRISMA. They state that they did a systematic search of Medline, PubMed, and Google Scholar, so three databases, although the first two, Medline and PubMed, are somewhat overlapping, but that's not to be discussed at this point. And they did that search up to the 17th of April 2020, so it gives you a time frame. So it is the available evidence up to the mid-April 2020, 2 years ago. They looked at the evidence that pertained to prevalence of depression, anxiety, and insomnia in healthcare workers during COVID. And they verified for the pertinence of the identified records by two independent reviewers, as we said that it was essential to do. Again, they looked both at the level and the quality. So the level is the epidemiological studies. For the quality, they looked at the risk of bias. The risk of bias is a tool or a concept that was first derived from the AHRQ work, and that now has been devised in a variety of different scales, including this Newcastle-Ottawa scale, that is the one that they have used. And then they have used an in-house quality scale to look at whether the sample was representative and whether it was an adequate sample size, the comparability between the respondents and the non-respondents, the certainty of depression and anxiety and insomnia. That is, how do we define depression, anxiety, and insomnia? Those are issues that relates more to psychiatry than COVID per se, but that are important in establishing the homogeneity of studies. Are we looking at the same thing, or are we looking at apples and oranges? And the adequacy of descriptive statistics, which again pertains to the homogeneity of studies. In their in-house criteria, they had a total quality score that ranged between 0 and 5. They ended up having 13 studies for a total sample size of 33,000. For anxiety specifically, it was 12 studies. For depression, 10 studies. For insomnia, 5 studies. So again, here they present a meta-analysis. Now, what they have done here was to present the meta-analysis with, if you follow on the ordinate of that forest plot, you see that they have two studies with the SDS, the self-rating depression scale. They have three studies for the patient health questionnaire assessment of depression. They have one study for the Center for Epidemiological Studies assessment of depression. They have one study for the Hamilton Depression Scale. In other words, what they have done here was to pool the studies, but their studies define or determine or obtain their outcome measure based on different criteria, based on different measures. So the issues that the reviewer might have, that you might have as you read the paper, is whether, for example, the SDS assessment of depression is homogeneous to the Hamilton Depression Scale or the BD, the Beck Depression Inventory. Psychiatrists would probably say no. Psychiatrists would probably say that different instruments to measure depression look at different aspects. Yes, those aspects overlap in some fashion, to some extent, but there are different aspects of depression. So whether really these studies are homogeneous enough to produce a meta-analysis is questionable. And so when you look at the overall, the very last symbol, you have one that is stretched to some extent. It is not stretched as much as the PHQ-9 subgroup, which tells you that there is a lot of variability in PHQ by itself in those three studies that looked at PHQ-9. But the overall is actually determined or driven by those 6 studies, including the PHRQ by Zoo, that are on the left-hand side of the line of reference. So this particular meta-analysis, at least to my eye, is a bit questionable and not very informative. And I rely more on what their conclusions are from a qualitative point of view than a quantitative point of view. What they find is that the healthcare workers who care for COVID patients suffer from significant mood disturbance. There is a high prevalence of anxiety, the highest prevalence being among female versus rather than male healthcare workers. Now, what is interesting, what is perhaps the more informative in the context of our discussion today, is that the two studies that we have looked at actually produce a similar type of outcome. That is, we can taking together the Vadgese finding and the PAPA finding, we seem to be able to generate a consensus, the consensus of the best available evidence. And the consensus of the best available evidence about the effect of caring for COVID patients is that it seemed to have important effect, significant effect on the mental health of the healthcare workforce. So in brief, what we discussed today is the difference between healthcare based on the evidence, which is nonsense, and evidence-based healthcare, which is the way of the future. We have discussed the protocol on how we can obtain the best available evidence, how we can obtain the bibliome, and how from the bibliome, looking at the level and the quality of the evidence, we can obtain a qualitative and a quantitative meta-analysis derived statement of the best available evidence. And we have made the point with two examples that even if we have issues, problems with meta-analysis, we can always go back and rely on the qualitative statements of the best available evidence in individual systematic reviews. And sometimes, like in the two examples that we have provided here, these statements of best available evidence actually are homogeneous, actually converge. They converge into a consensus of the best available evidence. So in this presentation, I wanted to give you an example of how we obtain the consensus of the best available evidence. I invite you to look at these papers carefully and in depth, following the slides that I have provided you as a guide. And I invite you then to look at the paper by Ramos, because those three papers are really examples. They are the yellow brick road for you to find your way through the best available evidence. And if you still have questions and issues, don't hesitate to send me an email. I will be delighted to converse with you. I thank you for your attention and wish you all the best.
Thank you so much, Dr. Francesco Chiappelli, for that very comprehensive presentation on how we can effectively and appropriately utilize the system review and present our evidence-based nursing practices. We are truly grateful for the wisdom that you have imparted in this webinar. And now we will proceed with the question and answer portion. We have two questions for Dr. Chiappelli. First, what do you think is the best framework for evidence-based practice that utilizes problem-solving approach in clinical decision-making? Next question is, what are some of the key elements of evidence-based public health?
Good afternoon. Well, I was provided with two excellent questions, which I would like to address at this point. The first one states, what do you think is the best framework for evidence-based practice that utilizes a problem-solving approach in clinical decision-making? Well, I would think that an evidence-based clinical intervention framework is by definition a problem-solving approach to clinical practice. Whether we are talking about evidence-based medicine, evidence-based nursing, evidence-based dentistry, and even evidence-based psychotherapy, evidence-based clinical intervention per se always refers to this conscientious, explicit, judicious, reasonable integration of the best available evidence, the most recent best available evidence, the clinical expertise, and his or her interpretation of the clinical findings, as well as the patient's value system, needs and wants. That is, in essence, evidence-based clinical intervention. So evidence-based clinical intervention is always directed at evaluating the efficacy and effectiveness of evidence-based clinical outcome. And in that sense, it is always a problem-solving approach. The evidence-based approach is the most optimal framework for developing and improving a problem-solving approach to patient-centered, effectiveness-focused, and evidence-based clinical care, but is particularly for those points that I just covered, because we're looking at the best available evidence, because we're integrating that with the clinician expertise, because we are taking full account of the patient, the clinical findings, the laboratory findings, and because we integrate also the patient's value system, needs and wants. So the evidence-based approach to clinical intervention is a problem-solving approach for the simple reason that it presents and integrates this current evidence-based movement, which aims at increasing the use of high-quality clinical research in the clinical decision-making. It aims at providing the physicians and the nurses with the fastest and the most science-based answer to the clinical question at the point of care. In brief, it aims at systematically identifying, select, evaluating, summarizing, synthesizing, and updating the best available evidence for the benefit of the patient. And in that sense, it is patient-centered, effectiveness-focused, and evidence-based clinical care. I hope this answer, I hope this answers the question that you have asked me, and I would like to go now to the second question. Second question was perhaps even more complicated and more difficult than the first. Thank you very much. It states, what are some of the key elements of evidence-based public health? Now, the key elements of evidence-based public health can be summarized as, again, the incorporation of the best available evidence obtained through this rigorous process of research synthesis that I have described in the slides, with the public health scientist expertise and the needs, wants, and value system of the community it serves. So the key aim of evidence-based public health, you could say, is to inform all the stages of program planning, implementation, and evaluation to improve the population health with the best available evidence. That is the key, the best available evidence. In other words, I would say that evidence-based public health pertains to the development, implementation, evaluation of effective programs and policies in public health through the application of the best available evidence about the principles of scientific reasoning, the data and information system, the behavioral science theories and programs, and all the other domains as subdomains of the science of public health. So in brief, I would say, in answer to the question, and making evidence-based decisions in public health means integrating the best available evidence in the decision-making process. Whether these decisions apply to program planning frameworks, to engaging the community in special health-directed programs such as vaccination, COVID vaccination, smallpox vaccination, and so forth, to conducting sound evaluation of such programs, and to disseminating the correct health-related information to the public. That is, combating misinformation and fake news in public health, which is so critical at this particular juncture. Well, again, I hope that this answers the question. And again, I feel honored and so pleased to have participated in your webinar. And perhaps this is the beginning of a great interaction in the future. I wish you all the best.
Thank you for sharing your perspective with us and for enlightening us with the best framework and key elements of evidence-based practice in nursing. May you continue your great influence to the coming generations. We will see you again later in the awarding of certificates, Dr. Capelli. We apologize to our participants because we cannot accommodate all questions due to limited allotted time. You can send your questions in the email address pinned in the chat box, and we will forward it to our speakers. This webinar is getting more interesting as we proceed to our third resource speaker to help us describe good governance approaches that will promote effective service delivery in nursing practice and nursing administration. Let me call on Mr. Kenneth Lubigan, Associate Professor de la Salle Lipa College of Nursing, part-time clinical instructor, Lipa City Colleges College of Nursing, NOMALEC PNA Batangas Province Chapter, to introduce our last resource speaker.
Good morning, everyone. It is my honor to introduce to you our next speaker. She is a highly spirited and passionate nursing leader who is a staunch advocate for nurses and nursing in the country. She has vast experiences in the fields of leadership and governance in the nursing service, academe, nursing regulation, and research. She started her career in nursing service leadership and governance, occupying various managerial and leadership positions. She was the officer in charge of the Nursing Service Division of Cardinal Santos Medical Center, then the Chief Nursing Officer and Director of Patient Care Services of Asian Hospital and Medical Center. As academician, she was the Dean of the Health-Related Sciences of Olivares College and a former Assistant Dean of the UST College of Nursing. Moreover, she is a professor of the UST Graduate Schools and former professors of the Graduate School of Olivares College, Concordia College, and St. Paul University of Manila. She was a member of the Technical Committee on Nursing Education of the Commission on Higher Education from 2015 to 2016 and was appointed as a member of the reconstituted Technical Evaluators for Nursing Education last January 21, 2022 for a term of 3 years. Her research experience has spanned more than 3 decades of mentoring undergraduate and graduate researchers. She was invited as a reviewer of research abstract of the International Council of Nurses. As a former member of the Professional Regulatory Board of Nursing, she spearheaded the National Task Force in the development of nursing first version of the Core Competency Standard for Nursing Practice in 2005 in the Philippines. She was a member of the Continuing Professional Development Council for Nursing, an active member of the National Task Force of the National Nursing Career Progression Program, the Philippine Professional Nursing Practice Standards Technical Working Group, the National Nursing Core Competency Standards Committee, and the Technical Working Group for the Comprehensive Nursing Bill. She is an indefatigable nursing leader who is constantly looking for avenues where she can be of service to the nurses and to the nursing profession. She participated in the Boot Camp for Good Governance by the Institute for Solidarity in Asia and the Global Nursing Leadership Institute training sponsored by the International Council for Nurses Birthday Foundation in Geneva, Switzerland. She was a recipient of an educational grant to participate in the Sigma Theta Tau International Biennial Conference in Indianapolis, USA, and was accepted as a mentor in Global Nursing Leadership Mentoring Community by the Sigma International. She is a member of the PSI Beta and the Alpha Alpha chapters of the Sigma Theta Tau International. Further, she is a member of the International Honor Society of Educators, the Pi Lambda Theta. She founded the Philippine Nursing Research Society UST Cell and subsequently was elected as its founding president. Moreover, she was the president of the UST Nursing Alumni Association and a member of the UST Alumni Association Board of Trustees. Further, she was the 2015 National President and Governor of the NCR Zone 6 of the Philippine Nurses Association, the Director of the PNA Nursing Leadership Institute, and currently the National Chair for the PNA Centennial Celebration this 2022. For her many contributions in the various fields of nursing, she was the 2017 recipient of the Anastasia Hiruntupas Award, the highest and most prestigious award granted by the Philippine Nurses Association and awarded as a distinguished alumni of the University of Santo Tomas. For her educational background, she earned her degrees in Bachelor of Science in Nursing, Masters of Arts in Nursing, and Doctor of Philosophy, major in Developmental Studies from the University of Santo Tomas. Without further ado, again, it's my honor and privilege to introduce to you Dr. Mila Delia M. Llanes, RN, MAN.
Thank you very much, Kenneth. May I ask authority to share my screen, please? May I be granted authority to share my screen? Disabled kasi yung screen sharing on my end.
Hold on, Dr. Llanes. We are working on it. Thank you, Doctor.
Okay, so while waiting, salamat sa pag-invite sa akin. And I'm just so happy I'm the last speaker because I was telling Jeb earlier, ang sasabihin ko na lang I echo everything that they said. Every speaker had a very good, a very significant contribution in today's webinar, and we learned a lot. Even myself, I listened attentively and I was taking down notes, just like Dr. Calvarita. He was also taking down notes. So do I have a permission? Okay, so I will share my screen. Can you see my slides now?
Yes, Dr. Llanes, we can see your slides.
All right. So again, thank you very much. And like what I was saying, the beauty of being the last in the last to speak is I can only say I echo what they have already said. No, but of course I prepared some slides, but some of the slides already duplicate what has been said. So later on, maybe I will just focus on the more important things that have not been discussed yet. So our first speaker, Dr. Ortalis, walk us through the different concepts, theories, principles of good governance. Dr. Calbalita inspired us, infused us with his enthusiasm and his commitment to make a change in the nursing profession. And of course, who will not forget the talk of Dr. Francesco Chiapelli on EVP. I was listening very intently. I learned a lot and it increased my knowledge about EVP. That's one thing that we need to infuse, need to integrate in our governance, so that all decisions that we make, all the programs that we plan and we prepare are evidence-based. So these are policies, programs, initiatives that are backed by evidence. So that's so beautiful. So we already have a full cycle of what we need to do as leaders. Okay, so I always begin whatever presentation I have, we begin with the end in mind. So since this is outcomes-based education, what outcomes can we expect in this presentation? Of course, alam na natin, we have already discussed the concepts of good governance. So what is good governance? Why it is so important? We also will be talking about the principles or the key elements of good governance. What are the standards of leadership and governance based on our locally mandated standards by the Board of Nursing? And then we will move forward to talk about tools and strategies. I would like to focus on good governance of a professional organization. That's the reason why earlier this morning I sent a message to Kenneth, and I was asking the profile of the audience, the participants in today's discussions. Who are they? What roles do they play? And I gathered that there are some local executives ng mga professional organizations, or there are deans, faculty, chief nurses, directors of nursing, and other key positions in any organization here. Because what matters in the end is how will you translate what we are discussing today or what we have discussed this morning to your professional duties and responsibilities. And we cannot talk about good governance without talking about leadership. Because who is the leader of the organization, diba? Who will do the good governance? Who will initiate? Who will motivate the people? Or who will practice good governance if not the leader? No? So leadership, according to Bennis, is the capacity to transform vision into reality. So this is something that we need to possess, or we need to demonstrate as well, because we cannot change just like the challenge that Dr. Carbalita gave us this morning, how can we improve nurses' participation in political matters? We cannot do that if we are not leaders. So he earlier distinguished or differentiated a leader from that of a manager. And we can do good governance if we are good leaders. No? And to move further, leadership is the use of one's skills to influence others, to perform to the best of their ability toward goal attainment or achievement. And this is the art of getting others to want to do what one deems important. So if we passionately believe that something needs to be done, then we should exercise our leadership capability so that they will also want to walk with us in attaining the goals that we want for nurses and for nursing, for our institution. All right, so that is how important leadership is as a partner or as a tool in attaining good governance. So it is really in the platform, in the environment. And this is how governance is defined by Merriam-Webster, and I think it was already explained earlier by Dr. Artalis. So just to repeat, the act of or process of governing or overseeing, control, and direction of something, such as a country, such as an organization, such as a department, etc. So in other words, in simple terms, sa Tagalog, pamamahala. Paano tayo mamahala? So we cannot really govern very well if we don't know how to govern ourselves, diba? We don't know how to govern our family. We don't know how to govern our group. So how can we govern effectively bigger organization if we if within ourselves hindi natin alam how to direct our activities, direct the things that we do, etc. So again, this is the process of interacting. Wait, I will just minimize this. Of interaction and decision making among the actors involved in a collective problem that lead to the creation, reinforcement, or reproduction of social norms and institutions. So we create this. We develop our strategic initiatives, and this will form part of the way we do things. So this will be our social norms, and we will be remembered. I mean, the organization will be known for the things that we have created or designed. And the Board of Nursing in 2017 promulgated the leadership and the professional practice of nursing standards in the Philippines. So this is embodied in a BON resolution that covers other matters, but there is a component or a domain about leadership and governance. So that was promulgated by the Board of Nursing 4 or 5 years ago. And in its purest form, it describes the structures and decision-making processes that allow a state, organization, or group of people to conduct their affairs. So, uulitin ko what I said in Tagalog. Iyon ay mamamahala ng isang leader. So this is how structures and decision-making processes are done. And it is central to creating and sustaining an environment which fosters a strong and equitable development, and it is an essential complement to sound economic policies. The reason why we do good governance is also to ensure that we are practicing sound economic policies. Kasi it's not only goal attainment that we address, but how do we spend or allocate our economic resources? So not only delivering the services, pero tingnan din natin, can we still survive with all the expenses, with all the services that we that we are giving to our constituents. So tingnan natin yon because that is part of good governance. So good governance is, among other things, it must be participatory, transparent, and accountable. And the voices of the poorest and the most vulnerable are heard in decision-making over the allocation of development resources. And why do we need good governance? Well, of course, we need to understand the need of the organization. We need to understand the need of the stakeholders. And therefore, after knowing their need, then we need to create and build an environment that will address their needs and their problems. And these initiatives or structures, strategic programs and projects should be embedded into the organization. It should be a way of life. So therefore, nandyan na naka-design na lahat. And this should be measured and continuously improved. I understand that one of the speakers, I think it was Dr. Chapelle, who said that you need to measure it so that you know if you are really progressing or not. No? So we need to define, or we need to identify strategies that are measurable. So there should be something that we need to have a database, so that after 1 year, after 2 years, after 3 years, we know if we are moving forward or not. And good governance is about building the right content around risk and strategy, embedding good governance in all levels of the organization, hindi lang dun sa topmost, kundi from the lowest sector, no? From the grassroots level, scaling up to the middle level and to the topmost level. And through measurement, again, the word measurement and assessment are there, and should be a basis for improvement. Good governance makes what is otherwise uncertain certain. Kasi you already have the measures, you have the deliverables, you know what to look for, you know what to measure, so that you can, you will really know if you are nearing towards your goal attainment. So in my simple perspectives, good governance involves strategically determining where we want to go. Saan ba tayo pupunta? So if you are a nurse, nursing director, how would you want your nursing service office or your department be known for? Gusto mo ba you are responsive to the emerging needs of the patients, of all the stakeholders? And then you develop the map how to get there. And sustaining all the different strategies to realize the goals and objectives of the organization. So that is my own simple perspectives. Magandang pamamahala. So kung ikaw ay nabigyan ng isang katungkulan, saan mo sila dadalhin? Ano yung dapat mong gawin? Paano mo lang nalalaman na ikaw pala ay nag-move forward or naka-stuck ka sa isang lugar? So that is my own simple way of interpreting my own perspectives of what good governance is all about. So consider this. When we live in an environment of change, ang daming pagbabago because of the pandemic, no? Ganyan, in the academe, we were now moving towards face-to-face, diba? In fact, last semester pa, nag-face-to-face na, 4th year. And what about the lower levels? They're now moving to face-to-face. So, you know, change leads to uncertainty. And uncertainty breeds fear. And fear leads to conflict. Should I go? Should I not go? Should I attend? Should I not attend? Stay home. For the past 2.5 years, almost 3 years, I've been stuck at home. But I'm working actively in nursing circles. I'm still at age 65, I'll be turning 66. I'm still actively teaching. They don't want me to retire yet. So they extended me. So I'm retired, but I'm repurposed. Nandun pa rin ako. I'm still part of the academe, both undergraduate and graduate school. But somehow we need to conquer our fear. And that for me, I conquered my fear last March 12, 2022, when I attended the strategic planning of Zone 6, PNA Zone 6, because they needed me there. I had to describe to them the roadmap of PNA. They wanted me to present, but of course, they just asked me to do it on site. They did not inform me what I'm going to do. I'll just be an advisor. Pero pinagtrabaho nila ako when we were there. And conflicts impedes good governance. The greatest trigger, or the strongest trigger for me to be there, was to coach them, was to mentor the younger nurses. Where are we going? So that if they know where we are going, then they would know what to do. So they can manage, they can lead the organization effectively because they know what to achieve. And they should really find the ways, the strategies, and how to get there. So I was there. And that was the day one that I went out of the house for professional engagement. At tuloy-tuloy na yon. Once I started going out, conquering my fear, invitations came one after the other, and then I said, "Ito na yung last Monday, we had strategic planning in UST for the College of Nursing, and then curriculum planning. I just came home last night after a 1 week work. But then I feel so satisfied. At my age, I'm still consulted, I'm still involved, and my passion really is I go where I'm needed. In fact, when I received this invitation, I told May, or I think it was Kenneth, you already have very good speakers. What do you need me there for? You don't need me anymore kasi ang dami-dami ng speaker. And they said, Ma'am, kasi you were referred, etc., etc. And then, because one of my passion really is mentoring, so I said, okay, I'll be there then. And so I'm here today with you. And good governance, of course, requires openness, transparency, integrity. We'll discuss more about these elements later on. And effective collaboration and performance orientation. Of course, the members of the organization should be oriented on what their the expectations of their performance. Saan sila? Because you don't expect them to be doing things if they don't know what they are what the things that they are expected to do. So why do you think that leadership is a good governance matter? Sa palagay ninyo, in your own mind, why is it very important? So in corporate governance wheel, so whether that is nursing or that is another nursing service department or a college of nursing or in the public health, in regulation, whatever field, you need to know your direction. You will never go wrong if you have this governance wheel, corporate governance wheel. Kailangan alam mo because that is where you're going. You need to determine what you want to achieve. So what are these expectations in the different areas of that organization? On customer service, on learning and growth, on finances, no? On risk management, and the delivery of the services. You must be able to identify the delivery of services. What kind of service delivery are you planning to have? And also performance improvement processes, risk management. When there are problems, of course, there will always be problems. How will you handle that? And the responsibilities of each of the stakeholders. what are the expectations for each of the officers, for each of the stakeholders, and then alignment of all the things that you are doing to the direction that you would like to achieve. And there are 8 major characteristics of good governance, and these were already mentioned by Dr. Ortalis earlier. So I will skip that and move forward na lang. Of course, these are the descriptions of the different elements. So in nursing, we really need participation of all stakeholders. So both men and women. No? And this is the cornerstone of good governance. Kailangan natin yung involvement of all the stakeholders. If you're in the College of Nursing, involve the faculty, involve the support staff, involve the students and other stakeholders, the alumni, no? The industry. We should be involved in your strategic planning or in your governance of the College of Nursing. Ganon din sa Department of Nursing Service. In fact, after the strategic planning yesterday, I got 2 messages kung pwede daw ba ako tulungan ko yung nursing service department to revisit their strategic plan, and if I can help them come up with a refocused strategy. Sabi ko, sige, and that will be on July 7. And then I got a message then from Ilocos asking me if I can help them with their continuing development on leadership. Sabi ko, sige, okay. And I cannot say no. Why? Because my goal really is to mentor. I am on my retirement age. I want to help more nurses or mentor more nurses. So, kailangan talaga ng participation. And rule of law. You know, one of the tributes of professional caring, of our profession, is that we should follow legal, ethical, moral standards. So, hindi lang legal, pero ethical and moral standards. So, that should be enforced. Minsan, pagka nagkakamali, paano ma'am yung mga nurses? This is for the presidents of TNA. Ma'am, hindi kami makakuha ng members. We cannot attract members. Sabi ko, tell them, it's part of their ethical responsibility to be a part of the organization. Why? Nasa Code of Ethics yan. Nasa Code of Ethics. So if we enforce that and check that each of our staff, each of our nurses employed in the organization is a member of the Philippine Nurses Association, because it is stipulated in our Code of Ethics. And also, of course, your Republic Act 9173, and hopefully in the next Congress, this will already be legislated. Kasi ang tagal na, 20 years old na ang ating 9173. It is necessary that this must be already approved in the next Congress, because we cannot move forward in nursing development if we still have the same old law, 20 years old na. So things have changed and we need to really move forward. Transparency, decisions taken and their enforcement are done in a way that follows rules and regulation. Information is freely available and accessible to those who are affected by such decision and their enforcement, and enough information provided in easily understandable forms and media. So that is transparency. And responsiveness. No? Institutions and processes try to serve all stakeholders within a reasonable time frame. Lalo na sa pandemic, one of the characteristics or attributes of a good leader with good governance is responsiveness. No? The agility of the leader to act and decide. Yan ang kakulangan ng some of our leaders. Ang tagal daw nilang mag-decide. Ang tagal daw nilang mag-act. So when something is worth doing, responsiveness is a critical requirement. No? Kailangan natin sumagot kaagad-agad. Hindi tayo pwedeng mag-deliberate ng so long. at least man lang may response. Yeah, I received your message. I'm trying to do something in order to address that, but please know that I already I noted that already and doing something para man lang ma-appease yung kanilang problema. Consensus-oriented requires the mediation of the different interests of the members of the society or institution to reach consensus on what is the best interest for the organization and its stakeholders, and how can this be achieved. So we need consensus building. So meaning to say, pagka-statistics yan sa consensus, we reach consensus kung dapat 100% agreement na yan, or kung strongly agreed ang mga members, 70 and higher is strong. Of course, 100% is a perfect consensus. And equity and inclusiveness, all groups, especially the most vulnerable, must have opportunities to improve their well-being. Equal opportunities for participation in decision-making processes. So yung participatory or shared governance, of course, is needed here. Effectiveness and efficiency, optimum use of resources, competency and performance of stakeholders, and result orientation. And accountability, the key requirement of good governance. Hindi po pwede na when something goes wrong, you will say, hindi kasi ako yun eh. Wala akong kalaman dyan. If you are the topmost leader, even if it is the accountability of the lower level management, you still own it because of your command responsibility and accountability. Pananagutan mo pa rin yan. You can delegate things, but you own the accountability pa rin. So the leader is accountable to those who are affected by those who will be affected by the decisions, those decisions and actions. Accountability cannot be enforced without transparency and the rule of law. So kailangan kasama yon. And another one, of course, the number 9th element is, by the way, yung title ng slide ko kanina 8. But while I was reviewing my slide last night, I chanced upon another article that says 9. So this is the 9th element of good governance. So strategic vision. And I think it's really, really very important. I believe so much in this, determining where the institution is going and how to get there. So therefore, in doing that, you will be able to know and lead where the organization, the department, or the college is going. Kasi alam mo kung saan mo gustong pupuntahan. And I just would like to give you a glimpse of what the Board of Nursing promulgated last 2017 as part of the PPNP nursing practice standards, PPNPS standards. So the first domain or element rather is personal and professional development. You know, we have to continue learning, enhancing our capability. It doesn't mean that when we finish our master's, we finish our PhD, that's it, and we're done. And we can already proclaim to the whole world, kayang-kaya na natin. No. That is just one paper, one document that tells us we have scaled up in our educational in educational level or attainment. But what is more important is our capability to lead, to govern. So we need to continuously increase our capability. So one of which is attendance to webinars, attendance to training, attendance to any opportunity that you can learn from. As a leader, I was still the vice president of PNA at that time in 2013, when I applied for the Global Nursing Leadership Institute in Geneva, Switzerland. And that was a life-changing experience. Of course, it increased my confidence in myself. It was a life-changing experience. And from there, I promised to myself and I promised to ICN kasi scholar ako doon. I gave them a leadership development plan. When I get home to the Philippines, I will develop a leadership training program for nurses in the Philippines. And that's what I did. I fulfilled my promise. I developed the PNA Nursing Leadership Institute. And now we have 3 batches of graduates. 2015, that was the first time. 2017 and 2019. But because of the pandemic, we stopped for a while. But within the year, so if you are a PNA member and if you're a leader, you can apply. Within the year, I think it will be by early December, we're going to have our 4th batch of trainees. And we have produced presidents of the association, marami ng graduates of the PNLI. And our first class is Marangal class 2015. And then we had Matatag class. Matatag ang mga graduates ng Marangal pala. We have President Melberg. Sila yung kauna-unahan. Sila Beryl Batad. And then Masigasig, graduates of Masigasig includes BON member Merle Salvani. We have Mari Luong, they're graduates of Masigasig. And the third one is Matatag. That was the most recent batch. And graduates of that batch include our chairman of the board of nursing. Oh, by the way, Marangal pala kasama din si Elizabeth Lagrita and so many other leaders. In fact, many of our EXECOM members of PNA right now are graduates of the PNLI. And we just had our first grand reunion last May 27, the reunion of all the members of the class. It was really a very joyful one, but just to let you know that kailangan talaga we have to continuously learning. We need to be lifelong learners. Personal accountability and responsibility that has been discussed already in the previous slides. And positive practice environment. This is the need of our nurses in all workplaces. So as leaders, as part of our commitment to govern, to govern effectively, we must be the first to promote positive practice environment. We should need to provide a safe space for all stakeholders and our social responsibility. And of course, our resource management. So these are some of the elements. Of course, there are indicators, but I will not anymore present it here. Now, so what will be our tools? Ano yung pwede nating gamitin na tool? I would like to share with you what we used in PNA, and we used the road mapping. We used the balance scorecards as our framework for developing our good governance framework. So dapat balance ang learning and growth, balance ang customer satisfaction, balance ang financial perspectives, balance lahat, pati yung mga processes, internal processes of the organization. And therefore, we need to write our organizational charter. Alam mo, in the undergrad, pinapagawa ko na yan sa undergrad eh. And, you know, it yields very, very inspiring results. Makikita mo na as a leader and as an educator, reading their BMGOs, I can only say, thank God, the future is in good hands. Because I can, through the reflections, through their BMGOs, I can already see what is the future of nursing in the Philippines. I know more or less yung mga visions ng mga students, yung mga future nurses, missions nila, goals and objectives. And if you put all this together, then you can say the future of nursing is in good hands. So for PNA, the creation of the PNA roadmap took several phases. So we conceptualized the roadmap in 2007. Can you believe that? During the time of former PNA President Leia Pakis, now a member of the Board of Nursing. And then 2008 to 2011, hindi pa ako active sa PNA national level. Development and refinement, 2008 to 2011. And then it was promulgated already 2013 and 2014. And implementation was 2015. So it took 8 years before the roadmap of PNA was born. And this is it. This is the finished product of the roadmap. And every nurse should know this so that they will know how to contribute. So if we follow this framework, nakikita mo yan, saan tayo papupunta. So you see, this is our core values. So driven by our core values as a nursing profession, the love of God, love of country, caring, quality and excellence, integrity, collaboration as our core values. We know that in all our decisions, in all our actions, these core values will be reflected. And our mission is very clear. Championing the global competence, welfare, and positive and professional image of the Filipino nurse. So, alam natin na ang reason for our existence is to champion the global competence, welfare, and positive and professional image of the Filipino nurse. So, pagka may nakita tayo na hindi professional ang portrayal ng isang nurse, nagre-react tayo agad. Bakit? Because that is our mission. And we know for a fact that we are promoting the welfare, we are championing the welfare of nurses. So, ano yung mga activities natin? Activities that really, truly promote the welfare of our nurses and their development. So that's very clear to us. So that by 2030, PNA is the primary professional association advancing the welfare and development of globally competitive Filipino nurses. So the vision is very clear. In fact, this can be achieved when we address the different development perspectives of the organization. As you can see, the black these black rectangles here, these are the development perspectives, service excellence, resource management, and social impact. So these are the different initiatives. I'm sorry, but I accidentally moved to the next slide. So these are the all this at the middle are the different strategies that we need to do in order to govern the organization. So that in the end, as you see at the top, yung social impact natin, diba? You can see that globally competent Filipino nurses providing quality and excellent care, the primary professional organization advancing holistic welfare of Filipino nurses, and a responsive organization of engaged and proactive membership. So we can only attain that if we do all this, no, at the middle. And as the former president of the PNA and the current director of the PNA Nursing Leadership Institute, I am showing you now the first batch of graduates of the PNLI. And these are our facilitators. You see, we just don't have facilitators coming from nursing, but from other industries. So we have here Krista Enns, who is an executive director of the ISA, Institute for Solidarity in Asia. We have here Henry Tenedero, and nurses, nursing leaders. We have Annabel Borromeo, we have Tito Barcelo, Bon, si Bon Dumlao. And then we have here Dr. Macaranas from Asian Institute of Management, and BON Carmelita Divina Gracia. We have PRC Commissioner Joe Cueto, nandito rin, former Dean of UP, si chairman ng board of governors nandiyan din, Castor Palaganas is there, and so many others. So these are the first batch of graduates of the PNLI. So why did I do that? Ang gusto ko kasi, well, in my mind, we will not be here forever. We need to train others. in doing that, we will bridge the future of nursing. There will be more leaders who are so passionate about nurses, about nursing, about healthcare, who will bridge us to the future. And in my semi-retirement life, I have repurposed my life, but I will still continue to lead. But of course, the cornerstone really is love. Kailangan mahalin ko ang aking ginagawa. You know, my personal philosophy is I go where I'm needed. Pumupunta ako kung saan ako kailangan. But my being a leader is always there. And of course, I want to leave a legacy behind. And if I continue to do what I'm doing, then that can be guaranteed. Na meron akong mapag-iiwanan, meron akong matitrain, meron papalit sa akin, nagagawa ng kagaya din ng aking gawa, if not even better. So, what are the outcomes? What are the takeaways? Nakuha ba natin yung dapat nating matutunan sa message, sa presentation na ito? The concepts of good governance, the principles, the tools and strategies. I hope that you were able to learn one or two of the things that I said. And wrapping up, good governance is the proper management of the state, society, and resources. It seeks to protect the interest of all people from all classes. It emphasizes on public sector management, the legal framework for development, accountability, transparency, and free flow of information. And good governance is so multifaceted and may be difficult to conceptualize and achieve in its entirety. However, excellent outcomes begin with a modest single step. So what is your next bold step? Tama ba that we just acquired knowledge? We are just inspired by the talk of the speakers? Or we need to take action? So even if we have the purest intentions, if we don't act on them, we may be run over. So ladies and gentlemen, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever happened, according to Margaret Mead. So I thank you for having me here today. Thank you for giving me an opportunity to be part of your learning. And I hope that as leaders, you will soon continue to practice good governance so that the goals of our profession, the goals of healthcare, will be logically achieved. Thank you.
Thank you very much, Dr. Mila Delia Llanes, for the very enlightening and motivating presentation. It helped us recognize the importance and impact of good governance in nursing practice and nursing administration. Dr. Llanes, we will now move on to the question and answer portion. Here is our first question for you. What are some of the drawbacks of good governance in nursing, particularly in clinical practice and nursing administration?
When I read that question, I said it's good governance, so there should be no drawback. It is something that is good, something that needs to be embraced, something that needs to be practiced. Well, the only drawback perhaps is it will be something that, when there is change, everybody will react to it. Everybody will say that's difficult to do. But if everybody collaborates, participates in the process of charting your governance framework, everybody will own it. And therefore, if they own the process, if they own the framework, there's no way that they will negate it, because they will say we did it ourselves. No? So I don't see any negative thing about it or drawback about it. In fact, I was so passionate in telling nurses, if you embrace the framework, there's no way you can go wrong because it's a sure formula for success. Thank you.
Thank you very much, Dr. Llanes, for the very informative answer. And I agree with you that when there is change, there is actually usually resistance and hesitations. But what is important is for nurses to embrace and to adapt to these changes. So for our next question, Doctor, what are the barriers in implementing good governance in clinical practice?
Well, the barriers are those, there are really people in the organization who are negative, with negative attitude, and they are the non-believers. They are the ones who always think negative things about what is introduced. And of course, they are the problems. No? So as a leader, it is important for us to invite them to join in and for us to orient them about the process, no? Para they will understand how it is done, and they will be contributory also to the continuing development of the framework of good governance.
I agree with you, Dr. Llanes. Thank you so much for sharing your wisdom and expertise regarding good governance in nursing. Thank you for inspiring our fellow nurses, nurse leaders, and aspiring leaders. Okay, guys, so that ends our question and answer portion. We will see you later in the awarding of certificates, Dr. Llanes. Thank you.
Thank you.
Now, may I call on Ms. Rosel Carrion, Clinical Instructor of City University of Pasay, College of Nursing, to introduce our last inspirational speaker.
Good morning. To inspire us even more, it is with honor and gladness to introduce to you our known nursing leader, educator, clinician, and government official. His unwavering passion in the nursing profession paved the way for him to champion the welfare of Filipino nurses employed in the country and abroad. He is a former national president of PNA and collaborated with different government agencies and other nursing facilities. After graduating from St. Louis University in Baguio City, he started working as a staff nurse, head nurse, and nurse supervisor in the Philippines, Kingdom of Saudi Arabia, North Africa, and Western countries. His role as an educator began in 1989. He is also a former faculty member of Davao Doctors College in Davao City. He was recently invited by the Japan ASEAN World Association of Public Employment Services in Tokyo, Japan. He was also invited in the first International Nursing Conference by the Philippine Professional Organization in 2017. He is the first ever nurse to be officially appointed as Undersecretary of the Department of Health by no less than President Rodrigo Roa Duterte in 2016, and currently the Undersecretary of the Administration and Financial Management team. He is also the current chair of the Selection and Professions Board for third-level and second-level managerial positions in the DOH. In December 2016, Dr. Tong An represented DOH in the United Nations held in Austria. He was also the senior official delegate in Oman last April 2017. He attended the 2017 High-Level Political Forum on Sustainable Development last July 2017 in New York, USA. He was also part of the Philippine delegation in 2019 Tokyo, Japan. In May 2017, he was nominated as board member in Geneva, Switzerland. He also he was also recognized by St. Louis University in Baguio City and the local government unit for his active involvement in the campaign against non-communicable diseases in the Department of Health. Recently, he was given an award of distinction at the 11th International Grand Alumni Homecoming of Baguio General Hospital School of Nursing for his exemplary performance as Undersecretary of the DOH and his contribution to nursing, government, and public service. His Doctor of Management, major in Public Administration, and Master of Arts in Nursing, major in Educational Administration, degrees reflect his profound value for knowledge. He finished Bachelor of Science in Nursing at St. Louis University in Baguio City in 1985. His scholastic qualification gave significantly and prepared him to assume his role as a professional nurse and public servant. A loving husband to Dr. Aleli de Vera Tong An, and a very supportive father to his 3 successful children in the field of medicine and aviation. Friends, to give his inspirational message, please join me in welcoming a nursing leader, an educator, clinician and seasoned speaker, a key official in the government and government representative, and the Undersecretary of the Department of Health, Dr. Roger P. Tong An.
Good morning. My warmest greetings and gratitude to the Philippine Women's University Graduate School for inviting me in this nursing webinar with the theme, Good Governance, Paradigm Shift in Nursing Practices. Good governance is such a timely topic following the recently concluded national elections and proclamation of the new leaders to govern our nation. Good governance, although there is no international agreed definition, aims to minimize corruption, take into account the opinion of everybody, including and most especially the minority and the oppressed, during the decision-making process, and respond actively to the needs of community now and in the future. In the context of public health, good governance should be directed towards 3 fundamental goals, as defined by the World Health Organization. Number 1, to improve the health of population to help achieve productivity or societal goals. Number 2, to respond to people's expectations. And number 3, to provide financial protection against the cause of illnesses and diseases. Depending on its intended purpose, people involved in scope, there are different principles to good governance. There are those that are common, regardless of the scope, such as participation, accountability, transparency, and etc. For good governance in the context of nursing and in healthcare, I would like to focus on 4: participation, role of law, and transparency, effectiveness, and efficiency, and accountability. Number 1, or first, on participation, through which all opinions raised and voiced through representation or institutions. We must continue to amplify the nursing voice and take steps in creating a significant impact in health, boost the nursing profession. Second, the role of law. According to the social contract theory, societies are bound by mutually agreed upon contracts or laws that are meant to keep the peace among constituents, to push for the common good of all. All societies, organizations, nations are bound by sets of laws. To implement good governance, the legal framework should be enforced impartially, and that every policy taken and implemented must be carried out under existing regulations. Partner with transparency through with information related to rules and laws are accessible to everyone, especially those that are directly affected by the policy. Third, effectiveness and efficiency. Every decision-making process and its institutions must be able to produce decisions that meet the needs of the constituents. Further, good governance needs institutions and processes to attempt to serve all stakeholders within a reasonable time. Lastly, accountability. public service is a public trust. All institutions involved in good governance have full responsibility to the public for the sake of improving the quality of society. These fundamental principles shall guide our path towards effective and quality service delivery in public health. Nursing practice and nursing education in the coming years. As the distinguished ambassadors of health, nurses must recognize the importance of integrating good governance and approaches in the performance of mandated functions. Challenges and difficulties in the executions of our functions may be inevitable, but we must view these challenges the way we look at a pencil. Once in a while, a pencil undergoes resharpening. This is what it takes for it to be useful. Our leadership and the management are much the same. In order for us to be effective in our endeavors, we need opportunities that build and sharpen our character, for it is through this that we truly learn and grow. It is therefore imperative that nurses continue to improve opportunities.
We apologize for the inconvenience as we were experiencing some technical difficulties. To capture the entire talk of Undersecretary Tong An, hence, with your indulgence, may I share with you the last portion of his message. It is therefore imperative that nurses continue to embrace opportunities that cultivate growth and learning in order to become more effective and compassionate nurse leaders. To borrow a quote from Florence Nightingale, let us never consider ourselves finished nurses. We must be learning all our lives. As today's activity unfolds, may it bring renewed passion and dedication to all Filipino nurses in embracing the role of becoming a beacon of light that will usher hope and inspiration amid the public health crisis. Together, let us realize our vision of the Filipino people being among the healthiest in Asia by remaining safe and healthy until we eventually hold victory against the pandemic. Once again, thank you and good afternoon. Thank you very much for that heartwarming address to our virtual nursing community and for gracing us with your presence, Undersecretary of Health, Administration and Financial Management, Roger Tong An. At this point, let us all be inspired by our classmates from China with their video presentation.
下了印记，千里万里接近生死的距离，最危险的境地有你挺立。
看不到你的容颜，听得到你的呼吸，隔窗相望，隔不断爱的希冀，最需要的时候我们相依，
在一起我们不离不弃，在一起等待春风再起，
在一起迎接自由呼吸，为你喝彩姐妹兄弟。 春风再起，在一起迎接自由呼吸。为你喝彩，姐妹兄弟。因为有你，勇敢面对风雨。因为有你，积极力量和勇气。因为有你，我们一定胜利。因为有你，相信爱能创造奇迹。因为有你，勇敢面对风雨。因为有你，积极力量和勇气。因为有你，我们一定胜利。
因为有你，相信爱能
创造奇迹。
Feishan Ganshinin, thank you very much for the wonderful and heartfelt video presentation, my Chinese classmates. Sheshe. And now we will proceed with the awarding of certificates. To help us express our gratitude to our expert resource speakers, inspirational speakers, and participants, it is my honor and privilege to call on our overall webinar chairman, Mr. Reniel Sanchez.
Thank you for that very informative discussion, inspiring messages from our resource speakers. It's an honor for me to present the Certificate of Appreciation to our beloved speakers. So to proceed, may we call on our first speaker, Dr. Marie Antoinette Ortalis. The Philippine Women's University School of Nursing hereby awards the Certificate of Appreciation to Dr. Marie Antoinette Ortalis in grateful and sincerest gratitude for her selfless and commendable service rendered as the guest speaker during the conduct of the webinar entitled Good Governance, Paradigm Shift in Nursing Practice. Given this 25th day of 2022 via Zoom at Philippine Women's University, signed by the overall chairman of the webinar, Mr. Reniel A. Sanchez, and the Dean of School of Nursing, Dr. Minerva B. De Ala. Given this 25th day of 2022 via Zoom. And for our second speaker, may we call on Dr. Francesco Chiapelli. The Philippine Women's University School of Nursing hereby awards the Certificate of Appreciation to Dr. Francesco Chiapelli in grateful and sincerest gratitude for his selfless and commendable service rendered as our guest speaker during the conduct of the webinar entitled Good Governance, Paradigm Shift in Nursing Practice, given this 25th day of 2022 via Zoom at Philippine Women's University, signed by the overall chairman and the Dean of School of Nursing, Dr. Minerva B. De Ala. And last but not the least, may we call on Dr. Mila Delia Llanes. The Philippine Women's University School of Nursing hereby awards the Certificate of Appreciation to Dr. Mila Delia Llanes in grateful and sincerest gratitude for her selfless and commendable service rendered as our guest speaker during the conduct of a webinar entitled Good Governance, Paradigm Shift in Nursing Practice, given this 25th day of 2022 via Zoom at Philippine Women's University, signed by yours truly, the overall chairman of the webinar, and the Dean of School of Nursing, Dr. Minerva B. De Ala. Thank you. We would like also to acknowledge our two dynamic and great inspirational speakers and game changer of our profession. May we call on Dr. Carl Balita. The Philippine Women's University School of Nursing hereby awards the Certificate of Appreciation to Dr. Car Balita in grateful and sincerest gratitude for his selfless and commendable service rendered as our inspirational speaker during the conduct of the webinar entitled Good Governance, Paradigm Shift in Nursing Practices, given this 25th day of 2022 via Zoom at Philippine Women's University, signed by the overall chairman of the webinar and the Dean of School of Nursing, Dr. Minerva B. De Ala. And to our second inspirational speaker, may we call on Dr. Undersecretary Tong An. The Philippine Women's University School of Nursing hereby awards the Certificate of Appreciation to Undersecretary Tong An in grateful and sincerest gratitude for his selfless and commendable service rendered as our inspirational speaker during the conduct of the webinar entitled Good Governance, Paradigm Shift in Nursing Practice, given this 25th day of 2022 via Zoom at Philippine Women's University, signed by yours truly, the overall chairman of the webinar, and the Dean of School of Nursing, Dr. Minerva B. De Ala. And of course, the participants of this webinar will also receive the Certificate of Participation upon accomplishment of the online evaluation that will be posted later in our social media webinar link. Thank you so much to our guest speakers, inspirational speakers, and participants of this webinar.
Thank you very much, Mr. Renel Sanchez, for awarding the certificates to our resource speakers, inspirational speakers, and participants. I would also like to inform everyone that this webinar will be aired at the PWU Facebook page. We would also like to give appreciation to our very supportive professor, Dr. Mark Santos, to the Dean of School of Nursing, Dr. Minerva De Ala, Information Technology Program Chairperson, Dr. Menchita F. Dumlao, Department Head of Information Communication Technology, Mr. Michael Ventanilla, AB Specialist, Mr. Robert F. Thomas, Web Administrator, Ms. Lourdes Cabatuando, Administrative Assistant, School of Nursing, Ms. Marisol Rivera, Admissions and Marketing Manager, Mr. Nelson B. Gillian Jr., Multimedia and Broadcasting Department, Mr. Emmanuel Kiban, Ms. Rona May T. Tuanyo, and to the Multimedia Broadcasting Team, Mr. Bob Thomas, Mr. Popo Castro, and Mr. Vladimir Villamor. Without your guidance and efforts, this webinar will not be a success. Thank you very much. I would also like to acknowledge the men and women behind the organizing committee, the committee heads, and also to their respective members, Mr. Franz Farne, Promotion and Registration, Ms. Judy Celis, Communication and Documentation, to my team members of the program committee, Ms. Michelle Flores, Technical Support, Ms. Maria Socorro Castillo, Speaker Care, Mr. Renel Sanchez, Template and Layout, Ms. Mary Grace Sabal, Finance and Budget, Mr. Roy Arrasgado, Assistant Technical Team, and to Mr. Renel Sanchez, our overall chairperson, and Ms. Judy Celis, Assistant Chairperson. Before we end our program, may I invite our overall webinar chairperson, Mr. Renel Sanchez, Manager, Quality Improvement and Risk Management at Mary Johnston Hospital, to deliver his closing remarks.
Good morning, everyone. Thank you for participating in our webinar entitled Good Governance, Paradigm Shift in Nursing Practice. We hope that you enjoyed and learned a lot from this very interesting and relevant topic. We want to express our gratitude to our honorable guest speakers for sharing their valuable expertise, Dr. Marie Ortalis, Dr. Francesco Chiapelli, Dr. Mila Delia Llanes. To our inspirational speakers, Dr. Carbalita, Dr. Roger Tongan. To our respected healthcare governance professor, Dr. Mark Santos. To the Dean of the School of Nursing, Dr. Minerva De Ala, the faculty, and the PW technical staff. To all the nurses, student nurses, and allied professionals from different parts of the country who join us via Zoom, Facebook, and YouTube live streaming. Thank you for taking part on this very momentous event. It's been a pleasure to listen to and watch the discussion of our dynamic guest speakers as they share their knowledge and expertise in their fields towards good governance in nursing practice. Indeed, we nurses play a significant role to promote better governance to the next generation of health providers and making a difference in nursing leadership and the health system in general. And of course, putting our patients at the center of this development process. Therefore, our nursing pledge to carry out faithfully our service to people and to the high ideals and standards of the nursing profession shall be magnified in our respective healthcare fields, clinical practice, nursing academe, and public health. Of course, I would like to congratulate our class in advance on the successful delivery of this professional endeavor. This event shall be our takeaway inspiration to pursue as we continually expand our governance and our influence on our beloved and noble profession. God bless us all.
Thank you so much, Mr. Sanchez, for the inspiring closing remarks. Finally, we would like to thank everyone for attending and actively participating in this webinar. We hope that you were able to learn so much about and apply your learnings when you go back to your institutions. To our dear participants, the evaluation links are now posted. Please accomplish the form and submit accordingly. The certificate of attendance will be sent to you immediately after you have submitted your evaluation. On behalf of the Philippine Women's University, Doctor of Philosophy in Nursing, Governance in Healthcare Practice students, Section A, once again, this is Therese Antoinette D. Juliales. Thank you, and we are praying for the good health and safety of everyone. God bless us all.
Ma'am Therese?
Yes, Press.
Hindi na
Good
tayo